link here. You're live. I'm going to take this link and I'm going to copy it. And then I'm going to send it to you on Facebook Messenger.
Yep.
We've sent specs over 3 times.
Okay.
At least they need to get a new person here real quick. This way didn't do us any good.
I shared it on
I never went to meetings.
like-minded.
We finally got our septic situation. So that's, it took. It's gonna hurt buying and selling homes in Geauga County because people, you have a $50,000 home bank on escrow. It throws you off. You don't have to buy another house.
No, I you know what?
Yeah, oh, yeah. And that guy, I mentioned it, I think the young lady that was there one day, whoever built that plant for you, tracks, they're first class. If I was in your business, I would make sure I used them again.
Well, we did use some. Oh, yeah.
I have confirmation that it's working. Okay.
Do you want me to go for the test?
Would you like to do a test, please? Yeah.
Sure. And I just updated the link on the League Facebook page.
Okay, great.
Okay, I'm doing a test. Barbara, tell her to give the thumbs up, thumbs down. Everything here.
Yep. Let me ask one of our viewers. Could you speak at a louder?
I guess my normal speaking voice will be like this.
Wait for the
Okay.
So is this loud enough?
Well, they listen to me. What's his name?
Maybe a little louder because of the man.
He's here.
And I got a test.
He's in the meeting during the executive session.
Okay, we have one thumbs up.
Okay. So if I'm testing from over here, are they able to hear anyone who comes up to comment?
Checking.
It's a yes or no. That was a yes or no question. And if you can't choose one of those, say, I don't.
Keep
have the
speaking.
answer, I'll get back
Keep
to you.
speaking.
He
So I
said
have
he's
four
gonna
things to say, comment, blah, blah, blah.
Could barely hear you from up front.
This really
Oh, jeez. Great.
I just want to make sure that they get this.
He's gonna have his hands
Yeah, Dave.
So we can't ask people to yell.
moving
People
into
are
that building.
Yeah, we can't, we won't be allowed to ask
And
people
so
to
if people
speak up.
can't hear, then they
Not
can't
hearing
hear.
anybody.
Although they might provide a microphone for public comments.
But
Like-
the microphone doesn't work. It's very.
You're right, you're right,
And you have to put it right up to your mouth.
you're right.
So I'm assuming no one can hear this? Maybe you guys.
I'm gonna go bring it down to the bottom. So if they move it.
Right.
Keep in mind, there's also background noise.
We're a little jealous.
Shelley, keep in mind, there's background noise right now too, though.
Right, but it sounds like you're just not hearing me at all. So, all right.
Can they hear me?
Yeah, they can hear us now.
And they can hear now?
Okay.
Yeah, they said if you're talking, the one person talking about microphones, I can hear now, but can't see her.
Okay.
Yes.
Well,
Okay, great.
maybe there's hope.
Okay,
All right, that's the best we can do.
okay.
In my case, they never asked me like to do. You're going here, you're going there. I don't know. You were at West Point for a while too.
That's right, the system. Yeah, the end of my career. That's right.
That's work.
I went to your house for just 5
It's
minutes.
incredible experience.
He's certain me, young man, Steve, Dimitri, that,
Yeah.
yeah,
I
I like him,
just texted with him.
I like him a lot.
That's what we do.
But I've met him a couple of times and,
He's young.
I've been.
Oh, that's not what I wanted to do.
And I like him, but I don't think school. He's a young man with a baby not even a year old.
Right.
He just moved back to Bainbridge. Going back and forth, let's say he got elected. Going back and forth, he put a big strain on that family.
More strain than being for baby.
I spent 3 years on that show, initially, and then the Pentagon, different places. But then after I went to reserves, I only went to different shops. But the thing is, it weighs on the family. Were you married at the time, had a family?
Well, actually, I was, when I was in 83, I got married in 89.
Okay, well, that's
So we got married as Army captain in 03.
so you was established, okay? My case,
I was a platoon leader and all that, where I was gone all the time. I was gone frequently, you know, you go to Red, you don't go once a week.
Iraqi never should have gotten involved. Same as Vietnam. We were over there before with the Gulf of Tonkin crap. And we were doing things we shouldn't have been doing, as always. And then they put 500,000 people.
Yeah, most of our members of the VFW, yeah, that's what,
Not bad.
a couple of them, aircraft carrier guys. Yeah. Great group of guys over there.
Wow.
Good guys.
It sort of spoils your life because caliber person you come in contact with, you think you find out all around you, you don't always.
No.
You find some.
I mean, I've been very disappointed since I've been here.
You deserve to be.
I sometimes don't think Ralph likes some of my comments that I can make after the meeting someday.
Yeah.
He gives me that look.
Oh, I hate to
I
see
think
the
it depends on
buffering.
whether he has another meeting he's gonna get to.
He's burned the candle at 3 ends.
Yeah, they found all those guns down at Fort Town, or Bennett Township.
Yeah.
And I wonder, and I asked him the other day, he brought up, I think you might have been, have we found the aliens in Geauga County yet? And nobody said anything about this about a month or 2 or 3 ago. And one sheriff was there. So when I'm leaving that day, Hildebrand was there, and we get a driver. And Ralph was out talking to him. So I go, have you found those guys yet? And one of the deputies said, yes, we have. We'll take care of it. And I smiled. And nobody ever said anything after that. They're here no matter what.
And they are in the jail. We still get ice guys?
Well, they still keep that. I found they still keep ice kids.
We still have those.
But we're worried about the border in Ukraine.
This is worried about a border.
Yeah, that's first step, right? Recognize you have a problem. I gotta tell you, Jerry, they're gonna be in there forever. I don't know.
You people report to the commissioners, actually.
Yeah.
And you have your auditors, and you don't spend any money, as you pointed out, because of your bidding process. Has no control. They don't even pay rent. Well, I'm just,
They will be in the new building.
they will in the new building. If they move to the new building, there's not enough room for them.
They don't have a choice. They don't have a choice. It's a space that's being provided to them by the cash.
You and Glenn have your work cut out.
Oh, I know.
I'm surprised Glenn hasn't retired yet.
He's
You
wishing
should
to
say that. You should say that.
I say it to him, and he smiles and walks
I
away.
think 2022 is gonna see a wave of
Well, maybe they should give us a
I'm gonna believe in that. That's why Jerry and I go and we pick up aluminum cans on the side of the road, which is a high price on recycling. Supplement our nickel.
Plasma.
Donate plasma.
Is the Barlow plant working for you?
It's working and it's, you know, it's not full-time. I got whole crew full-time.
I thought you only had to have one inspector all the time.
If it-
It's a big operation.
It's big.
How many employees do you have?
I have not 41.
And a lot of equipment too.
Yeah, a lot of equipment, a lot of locations. And that's,
Yeah, I know you
that's
have a lot of locations.
40. Some are very small, they still have to be visited.
Well, the one on Coeur d'Alene price.
But they-
Okay, so I'm seeing you.
Yeah,
That's an old.
I haven't even been.
I thought I just did the current link. Let's double check.
I own a home on Coeur d'Alene. That's me out there.
I know the
You're
name, because
right.
I know the name, because that's what the part of
Let me go in and delete that link.
Thanks for visiting with me. I talk a lot, as we all know.
It's, I mean, that's how you kill time, right?
The link is working. Barb Partington. You know her?
This is.
Tell her the updated link. We sent emails
She
and
said it
updated.
worked,
Oh, good.
and the chat is working too.
Oh, good.
Well, I've been-
Excellent.
At one, for a while there, like, when Clay was still, they had to have the sheriff.
People were irritated.
Not
Can't
me,
I
I mean,
update
I just come and listen, but people were upset.
Hmm. I'm able to delete the old one from my post.
When's this meeting?
They're all right.
That's who ran this place.
The planning commission is a good meeting to go to. I go to that pretty much once a month.
Okay,
They have
my
people
post.
there. Charles Stevens is no longer the commissioner or chairman. A lady has taken over a lawyer and they run a good program. It's ABCD, it's all taken care of.
Yeah, I mean, I think if you look within the commissioner's hiring authority.
When I went into my post that I shared, put the new link, it already updated it.
You make good decisions, myself
My
excluded.
Facebook post
But no one
doesn't
else
let me
can.
edit. It's like the
I
original.
didn't realize David Faber was no longer with us. They say, Cindy said Christine says he's retired.
Yeah.
I didn't think he was that old.
Yeah, he was already retired before he came up.
I'm sorry to see him go.
He was a nice guy. I mean, I don't know how he did it, but he was very pleasant to talk to, and he seemed like he knew what he was doing.
Any
Great sense of
suggestions for
humor.
getting rid of
Yeah,
it?
yeah, he did
Oh, look at
have a
this.
funny sense of humor. You're right.
I mean, that makes all the world.
Down here?
3 dots.
Got a sense of humor, otherwise you kill yourself.
Nope. Getting it.
You can't remove that till you have the executive session, right? Usually.
Do you need to remove my stuff?
Okay.
All right, what's the trick? I'm struggling. I just can't get rid of this. Yeah,
You're not in the app, you're just like on it from Facebook, it looks like.
Well,
that's true.
corner, see if it's full screen. See if there's a.
Oh, I see. Yep.
Same part you.
You can do it. There we go.
Yeah, that's that, I understand.
That's helpful. But I can't see the chat. Should I be seeing the chat?
I got flack again today.
How do I see the chat?
Um,
I don't think.
I have full screen now, but no chat.
Have to screen again, you'll see probably a X on the
right,
top.
X out of the full screen. And then you probably need to sign in.
You're not logged in.
You have to log in to access chat.
Ah, okay, and I don't actually like using app. I like going through.
The actual YouTube.com.
Yeah, yeah.
So they're low.
Okay.
Like 3/4 on the side.
Let me do that.
Reinforce the-
Hopefully that lets both of us do
I
it
have in the office
because
behind my desk.
I'm in it too.
Well, we're separate users.
Correct.
So
I
we'll
even
find
have that
out.
special,
Okay.
you know, the lace
We shall
zipper
find out.
thing in there.
Okay.
So it has a-
the learning curve.
Yeah, I heard plenty from Glenn today about, where's your heart to choose? No more helmet, okay. Even at lunchtime, it was really almost
Oh,
knowing that
that's what it is.
they were all sitting out in the car with the car running.
So nice to be around people who
What's the
really
future for this place with these two?
Jennifer commented, "Hi Shelley, I can hear you." So some of our viewers have been able to hear what we're saying, which is good.
Main start
Okay,
date.
idle chatter, idle chatter.
The steps are perforated, the visors. That's really nice, it lets a lot of light in and also lets the least get through. Was it be a better meeting?
Oh, come on, you're doing it.
Better meeting up there?
Yeah.
God, yeah. I agree 1,010%.
Yes. What, the live chat?
You've got the chat feature working? Oh, okay, but you've got the link working for the live stream. Congratulations.
That's good. Well, that's good.
It was something that splash page or something.
Are they sharing it on
I
the
sent it to
ADT
you, I
site?
sent it to
Well, I
Frank.
can't set it on mine, so it'll confuse me, you know?
It's like the tree falling.
Right.
Doesn't make any noise.
Well, thank you.
Thank
We'll,
you.
we'll replay this, it'll be on our site, that kind of stuff. We get more viewers on replays.
Yeah, when we
How do
play
you
it, we
access,
cut out all
how do you
this
access
session.
Right, and I'm sure people appreciate that.
replay?
On our website.
Ah,
Right, so it'll be a replay. So that's useful.
Video on demand. You can watch
But-
it free, you can watch it free in the morning.
Dave, can you let her know if that stops working? Because she's gonna stop taking like prodigious notes if she can rely on the replay.
Well, he's recording.
Okay, but can you just let us know if it's not working? And she'll start taking notes again.
But his recording is what's gonna be on the video on demand, not the stream. Because the stream has all of this wonderful stuff.
Okay,
So he goes, so instead of being 5 hours.
right,
Right,
So that's what's gonna be on the video on demand. That's
Right.
what you want.
and
right.
we'll have a link that we can share for that.
Perfect.
So it's just like when, because Dave took care of the candidate forms for us at Cardinal and at Chardon. So that was just a really simple process for us.
It would be a more, that location, I would think.
All this goes away.
Yeah, I heard that they made you an offer. I heard you were, offered this wonderful equipment.
Yeah.
For free. For free, I was
No, thank you. Nobody needs that headache. Keep all of our equipment that doesn't work.
Oh, those cameras probably, you reuse those for something else.
No, you're
Where
right.
are they? Oh, like
One
directly
there,
here?
there, and there's one right behind us.
Oh, well, those would be useful. I've never seen them actually used.
He stays.
I'm not sure they know how to.
Started 271.
They'd be good for presentations,
That's
I
a hell of a
think,
lot.
you know?
Oh, they use
There's
calls.
a couple hotels down there by,
That's the thing with the city of Chardon, they have, they
the,
don't really understand, they have, IT people usually don't understand.
the
Okay.
rooms by the
They
hour.
go, well, there. How to use
Yeah,
people.
Tim knows what to do with it, yeah.
what time did you guys get?
And what they do.
It was like more.
Well, we have the camera, you know.
Well, it looks like they have the projector here for slide stuff and presentations. But I know they do a lot of training here.
So we did sheriff's DUI lecture. They didn't use any of this equipment.
Recorded?
It's
Yeah.
just a lot of cameras.
It was okay. It was
Those are microphones or cameras.
edited
Yeah,
previously.
they just don't do anything from what I was told.
Well, because they have to.
They interviewed a woman beforehand who
They have
was
set up the microphones for the council,
very
and
angry,
they have the microphone set up
so it sort of spilled into our segment.
for courts. Two different systems, and they have microphones for different directions, places for different areas.
Okay.
So this is set up for one,
What would be the purpose of
Angry
this?
about masks.
could be for commissioners.
Still be a thing.
So it should in theory be capturing what's going on in the front? Is that what this setup should do?
Yeah, but if they don't activate it,
Don't want to.
Hey,
then it's not.
congratulations on
activated.
the job with your.
So are you tapped into this?
No,
Okay,
I'm assuming that's.
but could you be?
8 years.
You know,
if they allow me to, I'd have to look at their system,
okay,
and I'm amazed, this isn't doing anything.
Set up for the home business.
okay, so this
Yeah.
just isn't very effective because it needs an extra step, is what I'm hearing you say.
And that's more of a, well, we went to Berkshire. We went to Berkshire. They were having issues with something, and the former superintendent said, we don't worry about that, we don't care about that, because we're gonna do school.
That's why we stopped, because it's recording too much. Like, that's why we stopped too.
I just want to make
Well, it was
sure
a
you're
former
aware.
superintendent. And he basically said, "Well, we're not gonna invest in these equipment for new school. It wasn't being rude, it was, and I guess
Yeah.
that's.
No, it doesn't make sense. It doesn't make sense. Now, have you been inside the new facility?
We did some tours of it,
Yeah.
during the building.
I'm very interested.
You'll probably never see the inside of
You
it.
got probably-
Really?
Bert has decided, to keep the money themselves. I think there's some internal squabbling between the school and village.
Yeah. I don't know if you were aware of this, Marla,
Yes.
but just, there's a cable fee.
Oh, yeah, the franchise fee.
There's a cable fee that all the townships and villages and cities
Oh,
receive. There's a
and-
revenue stream.
Any former cable operation in the Ohio area
Mhm,
had a franchise fee.
mhm.
Chester decided to give that franchise fee back to the consumer, they don't collect it.
Okay, so,
Communities can say, we're not gonna take that tax fee.
okay,
Part that some people don't understand is, if you have cable, and you're paying that franchise, if I have Spectrum Internet,
That's
I'm not
literally
paying
what.
that franchise. It's only connected.
Yes.
It's only connected.
Cable.
Cable. So if you have, everybody drops cable and have internet,
Yeah.
there's no franchise fee.
but there's a theory that there's a revenue stream coming in that the public bodies are supposed to be, or expected to be using to provide public television access, like GTV.
Yes.
And so a bunch of them are just taking the money, but then not contracting with a public television provider. So
Somebody
like
gets-
there are no channels. I don't think Bainbridge has any channels. Auburn certainly doesn't have any channels. So, you know, they can't go in and record and share meetings and
So how's that legal?
so that's the law.
Well, see, the law is, it's a three-pronged law. It was set up so communities didn't have to take expenditures to do any legal contracting with the cable company. Because in the beginning of cable, each community had to negotiate with a cable company. Here it was TCI, Cablevision,
Suddenly,
all these, and they had to, they had to get franchise. And some of it was for a right of way, but it's not really a right of way because it's connected to the phone, to the power, and those don't have right of way. And then the last part of it was community programming. Chardon was really big on, because the Dolans were big on local programs. I've been with cable since Cablevision back in '88.
dating yourself.
Actually, David, I leapfrogged. He built the system in Chardon originally. I started when he left.
Okay.
I heard stories about David. And then when he came back into town, I was working for the cable company, and my boss said, you go out and help him out in Chardon. He don't have it. So I was,
There's a lot more programming in Chardon, you know, like all their meetings. are recorded and.
Well, because that's because of Dave's.
Right.
But then
This guy has them.
Dave, trustees or council, other trustees don't want to read the statement. Commissioners didn't want to read the statement.
Okay, I don't know how to turn off the volume on this. I guess I should close this up until I come back. Everyone's enjoying our conversation.
I mean, like Cleveland, they have, I have friends that they tape every meeting.
Mhm.
And
Oh,
sometimes
I
the
know.
meetings go 6 or 7 hours.
Well, that's the thing that's so disheartening to us is that, you know, we're in like knuckle dragging range here, right? We're so far
Check
behind
tomorrow, okay?
on communications. And, you know, the mindset seems to be, well, we're providing the bare minimum. And it's like, well, yeah, you're complying with the law, but you don't have to make that, you know, that's the floor. There's no real reason not to try to include the public.
And we started, in the last year, we
No,
started
not
doing,
him, not him. We've got
Sound
a request for
they have
contract
a system called
for the
OWL.
project itself.
OWL.
Like, oh,
Okay. It does a 360 camera view, and we just
So I tell you.
get the link, they send out the link to everybody, we get it, and put it on there, and we replay it. So,
it's
And
useful.
as far as
I mean, it is useful
dates and jet.
being able to watch,
I'm just
but the
gonna
piece
send
that's
out
really missing,
a copy, just
and it just doesn't seem that hard
let an email
to
to
us.
But there's no
We're really
reason,
trying to
it's
use it,
obviously there's no
but it
reason.
doesn't
for
seem that
time
hard
to
add the next element, which is just the chat that lets
Consider
people
expanding
engage
the
and ask their questions.
I'd like to see you go out for Chardon, Chester.
Which you come to that point.
Yeah. It used to have some really bad trucks.
Yeah.
Well, we do go out to Chester. You know, we don't shy away. We go.
Dave and I went to Chester, because I lived in Chester.
Right, and it's all your saves from.
Get ahead of the game, but this, it sounds like.
The audience was just, she was trying to run the meeting. And she was like, why are you guys here? Proposing or Chester.
Something like this.
And then 2 meetings later, they gave back the
So let
franchise.
me do a reminder.
And it's like 5%, no one knows.
Right. No one knows. And it's only a problem if you're looking to be, the problem, I don't know, problem that I hear people complaining that the public doesn't engage. And I hear CCs and commissioners all the time saying, you know, please get
Yeah,
involved,
just
please get
put
engaged.
your mind.
That's really hard to do that when you don't have timely information. You have to show up at 9:30 on Tuesday to hear what's actually going on. And not many people have that luxury.
No.
You know, that's a luxury to be able to show up and attend that meeting, or pretty much, this is one of the more accessible meetings. You know, end of the day, more people are able to attend this. But the vast majority of meetings are in the middle of the workday.
I mean, it's like Chardon, that's like I said, the biggest meeting we ever had was. People complain, but no, it was pretty, yeah, the one that was, I forgot that one, was the Heritage House. Oh my God, we've had meetings and meetings about that. And then the other people complaining, we can't tear down the log cabin, we can't tear down the log cabin. It's like, the building's falling apart. You can't tear it down.
Right? You gotta pay to keep it going.
And you know what, and it wasn't, I don't think it was about money, it's because you're tearing down something that's been on the square for decades.
Great, well, I like to preserve historic things,
But I don't think
but
anyone,
it's not free.
but I don't think anyone's complaining about the new building. I think people are like that, so. It was strange when people were complaining about the trash. Chardon wanted to get a single trash.
Oh, provider?
Provider.
Mhm.
I would never thought that was an issue on Geauga County.
Well, people want like their choice, you know?
Well, I mean, I like having well water, and I don't want public water. We got sewer in Chester, where I live. Okay.
Yeah, people get pretty upset when we take away their choices. Although if they could negotiate a better rate, like rubbish renewal, I'd be grateful. We used to, we'd start a neighborhood chat on our street and just say, okay, what are you paying? You know, like for waste management, and the range was unbelievable.
Well, but we've gone through like 4 different services. Now with dumpsters.
That's who we're using as well. I think the only, my only misgiving is that we don't have any, but that was the nice thing with that, so they had curbside recycling as an option. So for us, that was a really convenient thing.
The scary thing about the recycling, sometimes
Here's the original.
they would take the recycling and just throw it in the
Founders
trash.
maybe
Yeah.
for.
And it's like, I used to do, when I worked at Payable, we did shows in Brunswick, they got the first recycling.
Well, yeah, no,
So they were gonna separate everything out, and
And then you don't know that that's actually happening. It's very disheartening.
because I went to visit my sister, and they had, one of my nephew was Cub Scouts.
That's right. Yeah, yeah, 30 years ago.
It's like-
But they were too there. But I was afraid to.
It's that term of.
For this asbestos.
Right. Well, I'm glad we have the new facility, you know, so I don't have to drive out to Warren anymore, just batteries of, you know, things like that. I'm very glad to have, you know, a new facility for that.
Township was talking about closing, were they closures? Sean talked about closing the recycling area because people were using it as trash.
I know, I'm in Auburn Township, and for a very short period of time, we had recycling, and it was just too much for them to monitor. People abused it, so they got rid of it.
The Township we still have it, it's at the old Chester School. They were talking about stopping it because it's not a trash bin.
Well, you have to see how people respond. I know Bainbridge has gotten much more aggressive.
That's what I like.
You know, they've installed cameras, so there's no people who are dumping.
And recycle, and then when they do recycling, there are other companies behind the recycling.
Right,
because
right.
Right now, it's not economical to recycle.
Exactly. It used to be a money maker, and that's been going the other direction.
That's an answer right there.
So, yeah, I wish we had better access to recycling.
I know, like, where my sister was in Oregon, every bottle has a price on it for how much it's recycled. Oh, a nickel.
Yes, well, I have a friend in Germany, and their trash, they just produce no trash. It's worth like, you know, we've got these big honking trash cans, and like a smaller recycling thing, and it's the exact opposite. For them, teeny tiny trash disposal cans, and then everything else is recycled. And the expectation is that you will produce minimal amounts. Because there's nowhere to put it. I mean, a place like Germany, it's not that big. You know, so you have to go somewhere. They have a lot more pressure, you know, to deal with that problem than we do. Well, I think they put it over there. 5:15. And they went in for purposes of a legal issue. Oh, Marla, just chatting away.
People are asking if the video pods, and I said, no, it's just because nothing's happening. And then I
Oh.
said, well, nothing's happening in this room, to be
Okay.
exact.
Maybe we can ask this one to
Just
move or wave.
not the idea of it down, it's just cameras out, bouncing, so something's moving.
Something's happening.
I know. Well, I've moved the camera a little bit. I apologize for the unstableness of the camera.
Yeah.
That's okay.
Yeah.
All right, have fun. Yeah, no doubt. I'll have to talk to this Navy guy now.
Yeah, Sean, Board of Education has two open comment. One is on agenda only, and one is open.
And that's the way it should be, I think. Because sometimes things come up. Go in there, you don't realize what you're supposed to say until they. Okay. That.
3,500 Chardon Road.
They limit the, commission.
Just the whole extension. There's a lot.
You got a good buy on the
But,
property.
no, I can understand you don't want to carry on forever.
Hooked up with a rooftop, wanted it, and ran her over.
Yeah, the, Board of Education Payable was what part of the city were, for about 6 months, we had 4-hour meetings with them on the weekend, every week. People coming in with complaining about money for the IXR. Finally, after 6 months, we're able to tackle out the deal. $1 for parking,
Everybody wanted to get into that facility, we had to stay out of the facility.
And they started minimizing how much,
So in the middle of the winter, like right now.
they didn't want to be there, because they couldn't go past midnight.
All right, I need to see if I can get logged in, because I wasn't able to, and I need to be able to check.
Really? They had their own restaurant. So in the middle of the winter, right now, if you were to drive on, they'd be watering plants. The water flowing all over it. It shows you that things can be done.
Oh, yeah.
If you have the right people to drive it.
Common sense.
Yeah.
That's ruined trucks. We burned everything for a couple of weeks. It seems like everything is military.
Well, it's there for a reason.
Yeah.
It's there.
Yeah. That stuff is nasty, greasy. You gotta switch right.
Did you share the name of the new health commissioner?
No, because I was panicked. I didn't get the information.
I think it was Cameron, Dr. Cameron.
He's an OBGYN.
Okay.
Geauga.
Okay,
Okay,
Only there for direction. Yeah.
okay, great.
okay, great. Great, Rita.
38 years in practice.
Where does he practice?
Pardon?
Where does he practice?
Here in Charlotte.
In Charlotte?
It's Geauga and St. Vincent Charity affiliate.
Is it Jeffrey Cameron, MD? Okay, great.
Oh, great. So, yeah,
I'll put that in the chat then.
that's, worth sharing.
Perfect, thank you.
Attorney.
Okay, can I borrow this for sure?
And I need to.
Should I put that in there? No,
Everyone knows.
No, because we're not doing it.
So hard to say yes, that's all.
He's from the hospital.
There's no reason,
No,
but I'll just share that.
I'm gonna put
When
the,
he
well, there's no
executive
reason not
session
to, but
with
it'll,
this individual.
Here's this
I don't see how he does it.
Jeffrey
They
Cameron.
took away from the Navy. and
He's
put
been
him
the
in the
medical director and commissioner.
Well, he was always in the Navy, but his service was with the ITSC.
You know, I thought I misheard. I thought I heard him say something about mental health.
I spelled with the emphasis and Noah.
And when they were just sort of announcing, like, it wasn't a real formal announcement.
No, it was medical director and health commissioner.
Okay. Is that different from what Quaid was? So he wasn't also the medical director?
I don't think so, because he wasn't a physician.
Oh, good point. Okay, that makes sense.
Lynn Roman, I believe is the current, is the acting medical director now.
Oh, okay. I didn't know that.
Oh, wait, who is it? Or Patricia, maybe it's Patricia Lemon.
She's been the acting medical
Yes,
director?
she's been the acting medical director.
I didn't know that.
Yeah.
Huh, okay. So they've consolidated those responsibilities into the commissioner's role?
Because she did
Yeah,
not.
I remember watching. it.
That's what Gail.
Well, that's a lot if you're already a board member. To also,
I think she gets to. I sent the message with the NMCC, but
I'm not
they
sure.
sent it the wrong way.
I think
The message was coming in the embassy, that the Israelis would action. And the Israelis had warned us days in advance
On the other side of you.
to get it out of there. Because everything was, there was no cryptographic at the time. Everything was sent back and forth. Since the Egyptians were here, we would take recording.
Yeah, no, that's okay.
And they were creating the whole. That's even just the planes and the heavily for kilos.
And the commission was.
We paid, well, we paid for it, we didn't pay for it. Yeah, right, sure, but nobody was ever gonna do anything about it. Johnson was president.
Always a touch issue.
All of a sudden, my boss.
That's Rita.
They wouldn't get the message.
Oh,
They wouldn't put it on the way. They both took for Richie and me and
Huh?
McCree.
Take one side. Like you just said.
He saw it, said it was a mess. Put it out, the internet, not the internet, high frequency over to Cagnew and then up to. Too late.
No, so he.
I never.
UH, the gentleman.
UH, yes, UH, and I think she said St. Vincent's Charity Hospital was. Like her two sisters, UH and St.
I don't know, because I just
One of
looked
the,
up.
also the reasons I write. Well, I got my 20 years. Civilians started to take over everything.
I can't get another dog, my God.
Hey, Rita. Did you handle your phone? Yeah. Taking a snapshot of Marlon sitting here working on.
What's that?
Just snapshot of Marlon, document, arrangement.
We had everything. We had all that.
Oh, well, I just.
And then all of a sudden it's like, no contractors, and all of a sudden it's every town started getting reactivated, and we're doing this, and we're all- started pushing more. Around the room, and Halliburton, and it's like, why do we pay?
Well, just contractors, just to do the mess, cook the bacon and eggs here, pay a fortune for.
I don't. We don't really have any problems, we really don't even have cookies or setting them up.
No, it's all civilian contractors.
Or if you do have field, it's all prepared food, like Stouffer's kind of stuff, and just heat it up in hot water, and then they, kind of freeze it out.
Yeah, somebody.
Yeah. Here's one last thing with this guy, he's been a long
Thanks.
time. Government. He had no experience at all in the Navy,
So,
but he came on and
so.
said that, I made this.
The other river is on the field.
I understand.
Right in the back.
Well,
It's live streaming right now. We are talking to everyone.
and that will make a determination. What happens is if you're at a staff position, as you do, you have to go back out on the maybe not so much here, but as a line officer in the Navy. You have to go back to Vietnam. Yeah. So you'll never come back to staff position.
We're getting a question.
Oh.
So he didn't give me a bad business report. I always had good business reports.
Oh, okay, I can ask that.
They had it again.
Let me summarize
All the way
that.
to my level.
Can you thank her for that comment?
Yes.
We'll do our best. I've been assured by Mr. Moreno, as long as I can keep my comments to 2 minutes.
I haven't told Travis about my nose.
Yeah, well, that's automatic too.
But that wasn't on. Now it was, and if you did have lights and you saw the intersection, you had to go overseas for 2 years. Through all that.
Well, that's right. And you have the staff position. But the thing is, you have to see. You want to see.
And I'm like, yeah, I don't know.
And.
What I think about it, just like odd spots and stuff, but that makes sense why.
We had a.
There's one spot.
Greece.
Build a house right over there.
And I was told.
Keep that intersection.
It's a holy mess. State Department, public law 480.
Put out a trailer or something.
Or maybe communication stations were huge, probably 200-300 acres.
There's really no.
The transmitter site, you're being in business, and you understand, you need a lot of insurance. Yes. So I pulled the forms out, and I looked at them, and the antenna, the Rubik antenna. And I said, tear the antenna down and bring the line in. And he said, when I get this message from the State Department guy, can't do it. This is a true story. And I said, why not? He said, because we're using it on a round going down in the India. So I said, what's over half? That's me. So I called up the CIA. On all of them, 4586, you know, answers from 4586. I'm giving this a data communications group. This stuff is the CIA. Now, we're in a big boardroom, we're in a, and my reputation is noted for my personality and my temper.
Yeah, I imagine they'll be making an announcement.
Now, some people.
What is the agenda? Well, you probably need to refer to that too. I was right on that. We have.
You know what we are? I said, you're in the phone. Well, I said, we need to meet. You can't come over here and meet. I said, you're in the phone. You're on K Street or whatever. This was the conversation we had. Oh, we have to meet in New State in the Hall of Flags. Have you ever been in New State?
Yes.
The flag. Now, there's a lot more out there. When do we meet in New State in the Hall of Flags?
You're talking fuzzies.
Yeah, the fuzzy bar or whatever it's called about.
Yeah.
It's a nice building. It's only 7:30. But we met on the floor. I mean, that was a high end. Now, I'm into like I am.
Okay, yeah, I mean, I can totally.
Are we gonna meet in the Hall of Flags?
It's like,
Yeah.
take it all, every little bit.
Everything.
No, I
And
mean,
then I said to him.
Oh,
Okay. We went, it cost $1 million.
slightly.
And this is right after, when they got rid of the king of Mexico.
Yeah. Well, I don't remember.
They had to have receivers over at the king.
I go at 2 a.m.
City that's down the road. And it was all public law 480, the same thing, public law 480 money right now. Money under the table, money under the table. So, and I was sitting in this fancy room on the 7th floor. And they said, what's the deal? Maybe he's not gonna pay it. I got walked out. Now, this is a smart ass. I wasn't even going near 30 yet. So I got to see out the wife, the captain, the captain, yeah. And I told him what I'd done. He took care. So eventually, a check was drawn. Now, it's over. Yeah, a check was drawn. I was treasurer of the United States. It didn't come out of the Navy. It came out of one of their own pockets.
October meeting or something, that was the last time I was there.
It was fun. Well, he was special that you and I could do it all the time, right? So I couldn't have, I was married, got children, to go back over to Vietnam. And they even have to, I was working for Easy Corporation out of down in Tennessee. And they came after me 2 or 3 times and offered me graduate school.
Sure.
At the same time.
We'll find out.
You can always get it.
Oh, yeah, good idea. Can I help with that?
My
or-
wife couldn't have.
Maybe, let me see.
Oh,
Oh, it's reversed.
Yeah,
It's reversed.
We could type it in, type in the main,
Yeah, I'll type it.
you can type in the main topics, because that may First question.
It wasn't 27 years of West. You know what I mean? Yeah, I went to grad school a few times.
Yeah, I went to the Industrial College in Mount Forest.
Thank you.
Some,
Right?
yeah, and now it's all here, something other program, but it was a 2-year program.
It's great education.
Oh, yeah.
It's like they really do. I don't think I really like classes. I didn't go to school.
The beautiful chapel and all that.
I used to go really.
Oh, yeah.
I had no idea.
I ended up, one of my many jobs, I went to Cleveland State for 2 years. During the training program, they worked with them till we-
Right now,
after 3 years, I had to.
no issue.
Because the kids were there, right? As an engineer, you better pay attention. Financial aid. Were terrible. Oh, yeah, right. Administrative. Well, Cleveland State was as bad as, I once applied for a job at Lakeland back in the early 80s. The president, I did not. He says, I have no idea, young guy. No, he was a reason. He says, we're gonna run this place like Team Zero. So you're not a team player. I said, no, I'm just a team player. You asked me to running, putting together a technical program called Ohio something or other operation. He had a girl from zero.
When they started the project, they were.
And the people trying to hire me had to sit there the whole time of the meeting, let him work on me a little bit, which didn't really good.
Did they ever already cover the old business? Health commissioner and administration position?
You can't get upset with
Well, they didn't talk about the administrator position
and they get paid very well.
or the, I don't know what that is. Anything? Okay, so they're supposed to come, but they already passed a
There's
motion.
a house.
Yeah.
No, they didn't.
We think, yeah. And a driver and everything else. Yeah. The day you go to work at Cleveland State, you get 5 weeks vacation. Is that how it is? You get a good vacation like 5. We have people, you show up for work for weeks for that. And then they complain about, we're overworked. I said, you people don't know what work is. The kids were bored. I had 1,000 students in my program, and they were all engineering. And most of them didn't have a lot of money. I couldn't even get them financial aid.
I got 2 more lots to sell those developers.
You know why it is?
Yeah, I saw it.
Yes, Steve,
I could sit here forever.
I know. I have to.
I guess it sucks to be you. I had to make the executive session at the end.
Because of the lawyers. Those lawyers. And the lawyers.
Maybe the public can request that they make the executive sessions at the end.
I thought this was all.
Well, I've heard Adam say that they do that as a courtesy to the attorney, that they don't want to make the attorney wait till the end of the meeting. So that's the reason that they schedule it this way.
Is there anything we can decide tonight?
Okay.
So basically give me a green light,
It's not on the agenda, so I can bring it up. I can bring it up.
But it does make it hard for people to know when to show up, you know.
Yeah. And nobody likes waiting.
Well, I mean, it's one thing if it's just a short, wait, but we're at an hour and 10 minutes already.
Oh, my bad, I just. Well, it takes so long to make.
You've got places to go and things to do.
Yeah, I got home.
I know some why.
Do you think we're time for public comment tonight?
Oh, they'll go through, they'll get to that.
What time?
They'll get to that.
8:30.
I might be sleeping.
I don't comment, I listen.
Who are good. I mean, we did that.
My bedtime's like 9:30-ish.
And then got charts up.
I mean, people could be at home, like making dinner and just having this live stream open.
Well, that's what I said to people,
You know, like these
contacts I shared
gentlemen
with.
behind us, like they have other things to do. They
Yeah.
could be doing those things, but then engage when the board comes back.
Right, that's what I said to people I know, my contacts. Please consider, if you're preparing dinner, to leave the live stream on, prepare dinner, and then tune in when you hear audio.
If you wanna
Right,
go
so you
all
can do
right.
your dinner, you can help your kids get their homework.
Correct.
Taken care of,
Or
work
they,
out.
you know, or they could just have the executive
You know,
sessions
by
at
the time
the
we get
end.
out of here, maybe
Or
spend
alternate
penny.
it. You could alternate it.
Alternate is not a bad idea. I've seen some public bodies that alternate their meeting schedule. So, you know, they'll have some that are in the morning,
Yeah.
you know, some that are in the evenings, others like at lunchtime.
That's kind of nice.
That's when people can
Yeah.
attend. Or just turn on the live stream, you know, like, and they can watch or listen to something during their lunch
Yes.
hour.
You can't
So that is a thing.
I know we can't, but you you always throw out a question, and you get, if you know they can't say it. If there's litigation and counsel
Came up
there's a problem, this is great.
Cause she always says.
Yeah, well, yeah, it could be.
It is.
Because like million people like us. they-
Oh, it's litigation. Yeah.
You need to read between the lines.
Yeah. Well, this isn't really in there.
Actually, if you look on the court docket, on the public record, it's, I think it's pending litigation with a former employee from the commissioner before Tom played.
Who is that?
Further back.
I looked on the court docket, it's public information. It was a woman who used to work here, and the former commissioner who just passed away. Yeah,
That's what it's.
that's what it is. I don't know if that's what the executive session is about, but that's what's on the docket on public records.
But they were supposed to handle a lot of this at the meeting last week.
I don't know, but the last time we came to the meeting here in December, we waited almost 2 hours for the meeting to start.
But then they just had a meeting a week ago.
Oh, really?
It was a private executive
Oh, yeah.
That's right, this was being discussed there. And for some reason, it's not been resolved.
No, they just, I'm assuming it's the same litigation that was on the agenda in December, because this was the same agenda style.
It's not gonna be resolved either, it's gonna end up in the courts.
Well, I think it already is in the courts, but the one man just passed away.
Oh,
It's very sad.
Well.
I don't know
It's a
the,
shame, because good group of people doing a hell of a good job, can't be tied up with this.
yeah,
Not that the reason people in Geauga County care about living here.
right.
And they have all that to go together. Like he with the water department, the commissioners, and everybody that does their own thing.
Right.
And I'm just a resident, I just wanna make sure that we don't get like the rest of the world.
2 residents. on
Yeah.
Truthfully, it's a wonderful place to live.
For sure.
It is.
Yeah, we're residents as well.
This could go 2 hours.
It's a beautiful rural community.
Right.
And we need to keep it this way for our children and our grandchildren.
Do they say COVID processes?
Well, that's my way. I just look in so many different places and see how bad things can be. And have moved because of these problems, taking my family with them. And then to make sure that they were able to go to school here, children and grandchildren. And we get some of them nice people. It makes all the difference in the world.
So did your family stay?
Excuse me?
Did your family stay here, like your
Yeah,
children?
well, I have two grandsons that now live in Puerto Rico because they like to live it.
Oh, wow.
You can visit.
My one daughter's moved away, but my wife and I, I had other family here. We just live in Russell Township and in South Russell Village. The people are fantastic.
Oh, my parents live in Russell. My parents live in Russell.
Well, it's a nice community.
Yeah, it's beautiful.
I just bought a house on Corey Lane there.
Oh, yeah.
Which is a real nice, I was talking to Steve. Oh, no. We have our own septic system, I don't have to worry about it. And then it uses sugar and water, which is even nice. too.
Right.
It's a nice place to live.
I used to have a friend who lived on Coy Lane growing up.
Well, it's beautiful homes.
Yes.
They even have no fire department, I mean, fire hydrants.
You
Yeah.
have fire hydrants?
Yeah. and
Wow.
Because it's basically like chagrin.
Okay, yeah,
But it's West
They
G
charge
schools.
us, but they do provide it.
that is nice. Although I have to tell you, when my neighbors had a fire, we had every fire department in the county there within minutes.
They help each other.
Yeah, I mean, the response was
In
amazing.
South Russell Village, we don't have a fire department. So Chagrin provides it, and
Right.
fortunately, we don't have many fires, but when there is a problem, the ambulance and they're right on it.
Right, everybody shows.
And the people who live there care about it, they get on the phone and they talk and they help one another around.
Where is Coy Lane?
I would too, if I lived on that road.
It's off North Street. It's part of Russell, it's almost really part of Cuyahoga County.
But it's still West G schools, right?
It's West G School.
Yeah.
And the first part of Coy Lane is all Cuyahoga County. And then you come to a place where they turned it around years ago and put the new Coy Lane in Russell Village. It's, you can almost walk from the end of Coy Lane where the septic system is over to Cardinal Lane and come up to Russell Road. So in the woods, it's that close.
Well,
It's spooky and it's all by itself out in the middle of nowhere.
It's actually really hard, like, you know, we do the voter count during the campaign season, and we have to know, like, where everyone is, like, the districts and everything, and it is so complicated in that area of the county, just trying to make sure that you're getting everyone in the right place.
It's one of the hardest areas of the world is when I had one of the jobs. The Census Bureau back in 2000, 4 counties meet together in Reminderville.
Okay.
Summit, Portage, Geauga, and
Cuyahoga.
Cuyahoga,
They all
yeah.
meet-
Okay.
They all
Yeah.
meet in one spot.
Yep.
Trying to figure out who is supposed to be.
Right, right.
It was, well, fortunately, I didn't have too much to do with it. We found the problem and turned it over to other people.
Oh
I
my
think that
gosh.
was kind of a fun job, though.
Well, it was, it was all, not volunteer, but a group of people like, retired people like myself, were all hired from from schools and from businesses and stuff. We only worked a year or so, but everybody worked together and worked hard.
Yeah.
And then all of a sudden,
Important work.
but one of the last things there was no furniture. And the office was on Broadway down in Summit County. where we lived. The only people with the desks were the big high-ups. We all had cardboard desks. No cardboard.
Okay, so you didn't bring your.
You didn't bring your cutting boards?
No. We had computers, about 30 or 40 computers. The young people did the computers at the end, and then we had to have everything destroyed at the end, including the desks.
Oh, really?
They came in from our apartment, put them through the machine.
Oh, but they were
Good
cardboard.
desks, you could stand on them, they were that well built.
Really?
But they were
They
cardboard?
were cardboard.
Wow, we should request
Sounds
some.
like the beds at the last Olympics. Remember the?
Yeah, they used cardboard,
They
yeah.
did cardboard beds.
Well, it was-
Yeah.
We had good people.
That's really cool.
So many different places and it was, we had 24 hours a day, so the computer and stuff. Now, I didn't work that much, but the thing is, just Everything got done and done correctly.
Mhm.
Nobody had to come and tell anybody what to do. They looked at it and they took care of it, like we should be doing.
It'll take a while, but.
Well, I think I'm probably gonna volunteer work for the census.
Well, I mean, no, it was not, I say volunteer, we all had to apply.
Well,
for
not
the job.
volunteer, you're right.
We got.
Apply to do it.
Paid pretty well.
Yeah.
And the biggest problem was when they come in from Washington, the Department of Commerce, and they send these people to Washington, and they didn't know what they were talking about. And you just shut them here and shut them there, and then they leave. But they have no idea what was happening.
Yeah.
Yeah, you send everybody out, take the test. It was fun. And then we had older men that were doing the work. And some of them got the work done so fast, they come in and drop their papers off, and you say, stay around and get paid, because they were paid out, we were paid hourly at the time. They just went home, you know, they didn't work, because they were all like ourselves, retired and hardworking people. Well, not everybody. There were a few political positions.
Well, I'm never gonna keep that in mind, because it's such important work.
We don't even have the results of the 2020 election for censorship.
Yeah, we do.
Not exactly.
We probably don't have it to the same degree, not with the level of complexity.
It's not 100% like it used to be in 2010 or 2020.
But they apparently have enough to use it as business.
I guess they would progress enough.
I can't answer that, but I feel pretty confident that the Supreme Court cares. So they must have felt confident enough.
Eventually, yes, some more things back and forth. But here in Geauga County, it was fine because it's such a small county and it's rural. But the cities, I don't know how they do it. Oh, yeah, there were, even back in 2020, there were times that you had to have a policeman go along with the census. I'm not gonna go.
I had times out here in Geauga that I had to have.
Did you?
people, because if you're trying to approach a house that says, go away and.
Go to the house and drive by first and look around, especially in the summertime when the weather is, make sure there are no dogs there.
Yeah.
Because the minute you get out of your car, the dogs come after.
I bet you've got some good stories.
Oh, well, like with Steve, I spent a lot of time in the military and the Cleveland State and different places, and, you know, a job's a job. It's like here, I'm just a citizen wanting to make sure that Geauga County stays good. And after what I saw, Mr. Quinn, and I make no bones about it, he knows my feeling on it, what Quaid did, with the Geauga County Fair and all, it was wrong. And he got away with it. And it shouldn't have happened. It was
Not a problem anymore.
personally, it was unnecessary. And then he tried to get rid of the Amish schools over in the Parkman Township. There's 13 Amish schools in Parkman and the other township. And they aren't telling the truth. He tried to get rid of them.
Are you the gentleman who supplies the books?
I do what?
Are you the gentleman who supplies the books for them? There was just a story.
No, that's Joe Davis.
Joe
Yeah,
Davis, okay.
he seemed like a heck of a smart man.
Yeah,
I mean,
he
he
was
really done a good job.
actually, he was a principal of, I think, Chagrin's school system.
Well, he cares about living in this community, and he cares about the Amish and how important they are. 20% of our population is Amish.
Yeah, he lives in Booker Village.
This gentleman here, how do you say his last name? Stephen,
I'm sorry.
the gentleman who was sitting here, was Stephen, who's at the water department. Is that right?
He's ahead of us. He's damn good.
How do you pronounce his last name?
Oleg.
Oleg. Okay. I wasn't sure.
It's spelled funny, but it's Steve Oleg. And he's 26 years in the military, including part of it was at West Point.
Mhm.
And he was in the Army Corps. I'm a Navy guy, so
But you still talk.
we have stories to share. But I retired before he even went on active duty, so just how old I am.
Well, I've been seeing his name quite a bit.
He runs a hell of a good department.
That's good to know.
first class.
That's good to know.
And they have to get the septic system problem squared away. Because to wait 2 years to get an escrow account on your septic system is unnecessary. Because I sold a house a while back, and it was a large amount of money that sat in escrow. So I could sell it, and it hurts, us. I mean, I'm okay, but I had to buy another house and doing things like that, and you wanna make sure they go smoothly. And that's the reason you wanna deal with nice people.
Well, I'm not sure that I understand that process. So could you explain that to me? So you sold your house
It's-
and you had it set up,
First, you have to have the man come in and look at it.
and so they examine your septic system to make
If
sure.
if they can come in, but in the winter, you can't examine the septic system.
Right.
And they're so far behind, so when you go to sell
It's
your
so
house,
loud.
you sell your house,
Am I
or you
too
can't
loud?
sell your house. If you sell your house and they haven't approved the
Just hear
septic
this.
system yet, they have to do a 20, 30, or
It
40.
sounds like a rodent in the wall.
And then you cost to put a whole new septic
Trying to get
system
the
in.
sticky stuff.
So,
Okay.
so
it's
if you
not-
sell,
You need
so,
Geauga.
let's say you sold your home for $100,000, and there's a $30,000 holdback, you only get $70,000 for your house.
By mortgage.
Well, and everything else goes along.
Go ahead, I'm just
And
kidding.
not just me,
It's not picking up on there.
But that affects.
So why?
From what I know.
What was on
I
it?
don't know.
Sticker, like
This is when I was part of the credit
I don't
house.
know.
Okay.
And would go out to
Because they're
buyers.
looking on
I've met
Facebook.
some good people, I've never had any problems.
So
Yeah.
Okay, now explain this to me about
There's so much
blood
property
supply.
turned over.
When
But these
the
are
Red Cross
problems
says like
that
the
should be
blood
taken
supply
care of.
is only at like, they only have like enough for like a 1 day supply.
And then the Harlan waste treatment plant over there.
Is that what exactly what
It's a
it
real
is?
headache for Steve.
honestly, I
I'm
don't
not
know.
letting anything out
And
of
the
school.
reason is I wasn't a volunteer for blood.
They're
I
so
went out to
hard
fires.
pressed.
Okay.
People,
Oh, cool.
they had to go to
So I went out to
commissioners
fires
and
and
get special permission
Oh,
to give up
okay.
a group of their
So
people.
that's what my role at
I mean,
Red Cross
because
is.
we have an observer.
Emergency
Is an observer.
management or-
And emergency
Okay.
preparedness.
So she does these reports, we put them online, and we have
So,
an observer who's always at the commissioner's meeting.
Yeah, I know.
So I've been, yeah, okay.
And yet she's
I was there
done the same 5 years. She knows, she asks questions. Yes,
But
she
then
is.
she writes up reports, and we share those online.
That's the
So-
reason people live here. If we don't have people asking questions, we don't have the answers, and we can't get like Tyler County.
Not Howard Day. I mean, meaning what? Can't get like Cuyahoga House.
Nothing gets done.
If the virus is working.
They can't even plow the streets.
Hmm.
Cuyahoga County and the city of Cleveland is in deep financial trouble.
There's just.
And they're gonna come out here something, oh yeah. The biggest asset to the city of Cleveland is the water department. Because Bainbridge and a bunch of other communities around here have to buy all their water, including Chagrin Falls. They buy their water from
From Cuyahoga?
Cleveland High, no, Cleveland, city of Cleveland.
I thought we get ours from Summit County.
Summit County, Ladue.
That's what do.
Yeah.
That's what. Chagrin Falls gets their water,
Yeah, mine-
and Bainbridge gets their water from,
Yeah,
Actually, I have well water as well.
well, I have well water where I live too.
So.
right, but Ladue is under City of Akron.
Yeah.
For the Akron water
Ladue is
supply.
being
That's right, yeah.
So you said Chagrin Falls, Bainbridge, they get their water from Cuyahoga, not Cuyahoga
From
County,
Cleveland.
Cleveland City.
Cleveland City. Chagrin, I've lived in on and off in Chagrin since back in 1970. But the thing is, Chagrin used to have, and they still do have wells. And if necessary, they could reactivate the wells and we have to buy the water. But right now, it's easier for the water bill for Chagrin Falls is very high,
I'm sure.
very, very high.
I remember when we first moved here, Tanglewood had, we were really happy we didn't move into Tanglewood because they had
Yeah,
their
they did their
own,
ups and downs too.
where they had their own storage wells. And that was running, the water table was low, it was running the
Same thing over off 306, not Bainbridge.
Lake Lucerne.
No, more across from you.
They-
Bainbridge and it was,
It's part of Baybrook.
Okay, but that, it's the same thing. They
Yeah.
have like their own water system.
Having lived here and moving back in at the time back in the 70s, the Gurney School was vacant. Because my kids went to school in Chagrin Falls. I lived in downtown at the time, and my kids lived in South Russell, so they went to downtown. And so I went to a Board of Elections meeting, a Board of Education meeting, and I said, what are you gonna do with the Gurney School? Board it up. They're gonna tear it down, sell the property. And I said to one of the members, he said, where are the kids gonna go to school? There are more kids from South Russell in the Chagrin system than there are from Chagrin. And and I pay the taxes on it, and it's well worth it. But the thing is, you have to plan ahead. Since that time, they've added on the Gurney School 4 or 5 times.
They're on their whole intermediate. Yes.
And they put the whole, and they've done a nice job. That intermediate school is beautiful.
Oh, it's lovely.
Oh, boy, they did it right.
It's a very nice building.
I've been to a few Board of Education meetings, not recently, but last summer. On a few others, and Chagrin didn't want us there. And they've had elections since then. They had a new
Oh, trust us, we know.
And Bainbridge, Kenton has new people now too.
We covered all of them.
Well, I paid attention. I haven't.
Good.
But that's, in the talking like where we're talking, it's not that anybody has any better ideas. We just want to make sure it stays nice.
Well, but to have it stay nice, you have to have ideas and be willing
Sure,
to
you
listen to.
you can't just have one person.
Right.
He sat there, he didn't listen to anybody, he just made every decision himself. And it was not right, and he hurt the Amish quite a bit.
Well,
And if we were here at the meeting, they fired him, we were all here, at least 100 people, and the police were here, so I don't know whether you people
well,
were here.
we were trying to attend virtually, so I was online, but there was no sound.
Virtually is not the hard way. One of the last things, since I'm on a soapbox right now, I like to share my feelings with you. We have an organization downtown Cleveland called NOAC. The most useless organization in the world.
Who do you want instead?
Excuse me?
Who do you want instead? Because I understand that the planning commission has to align with someone. So who are the players out there other than NOAC?
We don't have to, it's a, what they call a metropolitan planning organization. We don't have to be a member.
I thought, and this is from Gail, who knows more than I do.
We don't have to be a member.
But Gail said that she thought that they had to align with someone.
No, you can start your MPO, we're trying to get, not we, but they are trying to get late spin-off and move together with what, like Ashtabula has, and have Ashtabula, Geauga, and play together.
And
So
you're
much,
planning on a
so much
regional
politics involved. Example being in Geauga County, we collect $30 million a year in gas taxes, state and local, or federal and local and state taxes. Only get $5 million back every year. 25 million bucks goes to NOAC. And they use it for who knows what,
Does some of it get distributed back to Geauga?
5 million.
So that it all goes to NOAC and then gets distributed?
No,
Or-
only when the distribution comes out of Cleveland or Columbus, and they give, immediately, they give to our department, commissioners, give them $5 million bucks.
So we get a direct portion.
Yeah, 5 million. But the rest of, they're putting new bike paths in, 528. But they're still building it, and it's, another example thing is that if you go to Trumbull County on 87, in Trumble County, Mesopotamia area, there are bike paths on both sides of 87. They come directly to Geauga County, bike paths disappear. And if you ever been to
So why
downtown
do you think
Middlefield
that
on the
is?
road? Because they don't care about the animals.
No, why do you think we don't have bike paths? Why does the bike paths?
They're not, and it's the budget paths really what I'm at.
Oh,
They're
okay.
building them now, and they're coming along with, but they should have been built all along. And the 13 places where there's 13 schools, they're only, the kids can only walk up 3 miles to go to school. And they're all private schools. They have septic systems and their own wells. And there's 13 of them in Parkman and the other township, so Troy Township. And these kids ride their little trikes, they use their horses, and they go to school. And they put their clothes out, and they're cooking all the time and doing everything. These are wonderful people. And he tried to get rid of them.
But I want to follow up on your point now.
I mean, I call them budget tabs.
But
Well,
call it whatever you like.
And we'll,
But
no,
why do you think it ends at Geauga? Is that because NOACA is interfering, or we don't have control over how?
NOACA doesn't want to, they don't want to come out here and do anything. In 2019, we had a meeting, and they had about Geauga County Transit Association, which run the buses all around here, and they do a good job, run their job on it. And so we looked at, we had some questions on it. We had it in the Chardon Library. Never. So we don't know. They want to come out and take control of everything we do. They want to tell us how to run our own transit system, how to run our own water system now, and how to be part of the metropolitan area.
Do we need to do a better job of advocating for ourselves? I mean, we can't, because it sounds like there's a big pool of money sitting there.
Huge amount of money.
So how do we, as a county, go about accessing that? Do we need, because you can't get it if you're not at the table.
Well, the most you get out of NOACA is about $7 million a year.
Well, maybe we could get more. I guess that's my thought process. If
There
there's
are
a pool of
40,
money there, how
there
can we
are
get
40, there are 42 representatives on NOACA.
Mhm.
5 counties, Medina, Moraine, Cuyahoga, Lake, Geauga.
Mhm.
We have 3 people.
But they don't attend the meetings. So it's
Some
like we
do.
have 0.
Oh, we have people there, but they don't do anything about it. The only one commissioner that's ever gone down and fought for us was Skip Claypool.
Mhm.
And naturally, he's not there anymore. DeVore goes to all the meetings. Jim does. DeVore.
Okay, I'm thinking the advisory councils, that's different. Like
No, this
there's
is
a
the-
rural advisory council.
They have no control over anything. They can meet, but they're only, even then, in Geauga County, there's only 3 out of 42.
Okay,
So we have no control.
so even with like the rural, I would think like a rural advisory council.
I think they should provide coffee.
You know, like Cuyahoga.
I think they should provide
Cuyahoga to
coffee.
be in that.
They probably have it for themselves.
Yeah, maybe.
It's not to be part of NOACA. There's a law set up with the NPO probably 20 or 30 years ago. And Mrs. Galucci that runs it, Grace Galucci, oh, she's a tough woman.
Is that part of the Galucci?
I don't think she did, I think all the Galuccis are somewhat related. But she came in from Chicago. And she's tough. I don't think give her credit.
Tough meaning what?
She's tough. She's set in her ways, and she's never gonna bend from it. And nobody's ever gonna take her on for it. Here they give you 2 minutes to talk. Mrs. Galucci, when I talked, I haven't been down in a while, give me 3 minutes to talk to all the board. At the meetings 4 times a year. And she'd talk back and forth. She'd ask, we'd have questions. Nobody else cared. Because I try to say to them, we need to take care of the people in Geauga. The Amish need to have better Middlefield, especially in the winter. The Amish are treated, the horses are scared half to death. At least they have some place to tie them up. But in downtown Middlefield, it's a wonderful to have accidents all the time because of the horses get scared.
Yeah, yeah.
And we need to take care of those problems.
Yeah, I'm always so nervous when I drive.
Yeah, you gotta drive very carefully.
Those are good people. Yeah, because I don't want to be someone who picks out like the Amish buggy and the kids and the horse and,
That
you
could
know.
happen. That
So
could
what about
happen.
the accident that just happened? There were three,
Yeah, just recently.
yeah, and there was life flight over my parents'
Yeah.
home.
Oh,
And my parents thought, they didn't know what it was, and they were terrified. They thought somebody was landing a helicopter on their house. But they were thrown from the buggy, and they had serious life-threatening injuries.
But that's what we did. I've lived all over the world. I lived in DC and San Francisco. We just don't work together like that. We want to be like the group of people that are here right now, caring about us and the families and the way we live.
I'm very interested in this NOAC issue.
No, it's,
So I'm trying to learn more about it, so I appreciate that you're here, you know, to tell me
well, you gotta
your
take,
perspective on it.
they're pretty good about it. They'll send you information. You can sign on their website and they'll send it to you and update periodically on things that go on.
But you just feel like we're not getting our money's worth from the relationship.
None whatsoever. Well, how can we, out of three people, three votes, out of 42 voters,
Why not a coalition?
at one time, when it was first set up, all the counties had the same number of votes. Medina, Lorraine, over a period of time. There are more votes right now in the city of Cleveland, in NOAC, than there is any other
So
place.
you need a coalition, but who are your counterparts?
They said,
Trumbull.
they allowed it to, well, Trump is not part of it.
Okay, so who around the city?
Well, around here, we get Trump last year, Lake and Geauga, couldn't put something together, but it takes a lot of time and effort and money to be able to do it.
I think that's where technology can really help.
That's where we should be trying to do
I mean,
things.
yes, because you can work together on big problems if
Because we're rural and
technology.
city of Cleveland has its own problems.
Right.
But they take all the money that is garnered by NOAC and they use it for downtown Cleveland.
Yeah, we really.
Is there a-
Investments in technology. I really like to see that. I just want to have some areas that just the access is so important. So I would like to see that.
You don't want to get too crowded, but with the way the computers and the internet and everything today, you can live from home.
You really can't where I
We
live.
need to get better internet here,
We need much better internet. That's what I'm talking about.
but
I'd like to see much better.
NOAC will do it.
Has anybody ever gotten any answer?
Well, it sounds like the federal government is actually.
What is
they
the
have
proper
grants out
term
there.
for
Northeast Ohio.
Regional
Oh, it needs to see.
Oh, Northeast Ohio area.
area coordinating agency.
There you go.
Yeah, it takes a while for you to think about it. Adam Linke has his work cut out.
I think we should tell them that they should take an audience vote, that we should have the executive session at the end or something, or,
Really? Can we all agree on that?
yeah, I think we can all agree on that, right? Or at least have coffee first,
What there's
At least
happening now,
Pizza.
right? I mean, I'm just kind of saying like,
there's a major
Or-
problem going on in there right now.
or alternate,
Yeah.
no, but it was 2 hours last time.
It's a wonder if you listen, you probably could hear them.
Or they could at least alternate, like,
Right.
last month it was at the beginning.
Yeah.
Now it could be at the end.
I did
Especially
hear
because there are-
them say last month that they do it this way because they don't want to inconvenience the attorney. And yeah, I'm sure
Who's
that
paying
their
the
time
attorney?
is.
Oh, I'm sure the attorney's getting paid a lot of money.
Who's paying all the attorneys?
Yeah.
Well, maybe that's a question,
More money they make.
is that a question we can
And how
pose
many
to the
are over
board?
there?
Why are the executive
And they had
sessions
meetings
held
2
at the
weeks ago
beginning?
in-
I
in
think
Charlotte
any private
Township.
citizen can
It's
ask
supposed to be
that
me,
question.
But nobody else was invited to, only the group.
Okay, well.
I think as a
It's
group,
been like 4 years, so why hasn't it been handled?
Well, it really since Quade took over. The other-
No, this was before,
Way
the guy
before
who
that,
left
when
before.
He finally passed away. It lives by itself here. They have no control over it. The commissioners and the rest of it, we have no control over it.
I don't know, I think you get a group of women in there, and they'll make sure it gets resolved. Like, boom, 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 we have things to do.
It's up to the board of
So
directors here
the
to make that
guy that
decision.
was suing, he passed away?
He just died of COVID.
He just got it going.
Yeah, he was the,
So what,
Yeah, but that doesn't make the
it was the
lawsuit
former
go away.
commissioner
Now
before,
it goes to his estate.
it was the what?
it was, I believe it was the former commissioner before Tom
Correct.
Quaid.
Yes, yes.
Yes.
Yeah,
If you look
And
online,
there's plenty of evidence that he was corrupt, so I don't know why we're still.
but if you look online, there's like the
He
whole
was-
public
he-
docket
he
about
ran
it.
the show for over 20 years.
Yeah.
Yeah.
If that be the case, then the taxpayers or the citizens of Geauga County should have put a stop to it. The reason we come to, I go to all the commissioners meetings, and I go to the planning commissioners, and I go to the WACA meetings too downtown. They don't like it, they give you 5 minutes to talk, Mrs. Belucci. But at least if you can tell them that the Amish are getting disadvantaged by living in Geauga.
Yeah, everyone
The roads
leaves.
are terrible.
That's just sad.
The septic.
All you have to do is drive down Burton.
Just doesn't feel good. You know, you take
time.
time to,
He caused.
come out.
the Amish.
Very
I know.
disrespectful.
yeah,
Talk to those.
yeah.
And they were here, that day that they took Queen out, there were a whole bunch of Amish.
There were.
So
And they.
I didn't tell you when I met-
They invited him to the meeting.
when I went out to Cardinal,
I was-
it was fun, yeah, when we went out to Cardinal, they were recording our candidate form for us. And I assumed that this was Dave.
Oh,
Right, so we sit back, and hey, Dave, do this and that, we're talking about everything, getting set up. I called him Dave the entire.
Oh,
evening.
no.
And then at the end, he was like, oh, by the
So
way,
the agenda that.
I'm not Dave.
He didn't correct you at the beginning?
It's Brian,
Brian, it's
correct?
Brian, yeah.
Yes, it's Brian. I'm not Dave.
Right, but the agenda was different than what was published
I
earlier
didn't
today.
catch that. But the question is, what happened at the last meeting 2 weeks ago? in,
Oh, I do signs of life. Signs of life,
Oh, they're coming.
signs of life.
Okay.
All right, let them know they're coming back. Everybody left.
Hello, hello.
Yes, this Friday night.
Have any other questions come in?
No.
Okay.
Yeah, absolutely. You gotta get your official stuff for next time.
Sure.
Nope. Yes. It will be freezing.
Good.
Thank you.
Thank you.
Thank you.
It was freezing down there too.
Oh, did you turn the heat up?
Oh, you did? Thank you so much.
All these things are like interlinked and they do, none of them, like, they don't talk to each other very well, the heater units. My
I
office
have
is
a house
actually,
like that, so.
my office is linked to the front entryway, so it's either 1,000 degrees or it's about 4. There's no in between. They're like, oh yeah, just turn your heater up. They're like, oh shoot, it's tied to the front entryway. I'm like, that would make sense. That would be why it's either freezing cold or burning hot.
Yep, that's fine. Thank you.
What was the date of that?
They turned the air conditioning
Uh,
on.
January 7th or something? I was asking Rich the date of our last public
I
meeting.
was gonna say, was it?
Sorry.
Was that well?
What was
The
our
next
age?
one?
No.
Committee meeting.
Age public.
The committee was on the 12th, I
The
believe.
12th? Okay. Thanks.
All right, you have everybody back, if you want to call us back to the session.
Okay, so, thank you for all being patient. So, do we have a motion to move out of executive session? So, we have a second?
Second.
Okay, roll call vote. Mrs. Jones,
Yes.
Dr. Levan,
Yes.
Mrs. Roman,
Yes.
Mr. Gregg?
Yes.
Moreno, yes. Okay, so we're out of executive session. So.
We're back at EH committee meeting. Old business, Alpha. So you or Ashley? If you give an update.
Okay, so the meeting, Ashley, you want to give an update?
Sure. So we had an environmental health committee meeting, a public meeting on January 12th, where we continued to discuss the prospective plans for our operations and maintenance program. This is for our household sewage treatment systems. And essentially, as we've discussed, this is being enforced by ODH as a way to make sure appropriate maintenance is maintained on systems. We have not agreed or moved forward on the approval of fees at this time. Our biggest initiative at this time is kind of doing some investigation of the number of outstanding systems out there, discussions of our for sale property. Most importantly, though, we're really trying to figure out how we can get the most education and notification out to our residents and community members to really make sure everybody understands what's in their backyard, what they have, what the maintenance would be in the future, and what we're really expecting in the future when we do come to an agreement on what this plan will look like, to make sure everybody knows kind of what to expect, and so that we don't set up our county for failure, but we want to make sure we're setting everybody up for success and that we can really appropriately engage everybody in this process. But again, we have not moved forward with the approval of anything at this time, so we will continue to have these public meetings for the Environmental Health Committee. That's all I got.
Any questions on board? Okay.
No, so we're not, so last time we put something on hold, we're not voting on that fee stuff?
No.
No.
Okay,
Not this time.
okay.
All right, so the health commissioner and administrator positions, as everyone who is here tonight has heard, we hired a new health commissioner, Dr. Cameron. He's an experienced, what kind of doctor are you, doctor?
Very good one. OBGYN.
Okay, so he might have delivered some of us, I guess. I don't know. Anyway, not me, but whatever. So anyway, I'd like to welcome him, and we are very appreciative of him signing up.
Do you want to, go ahead.
And Dr. Reed?
And Dr. Reed will be resigning effective January 31st, and then we will have Dr. Cameron become the medical director / health commissioner on February 1st at midnight.
Yeah, it'd be
Something
a
like
seamless
that.
transition.
So it will be a seamless transaction. Okay, health commissioner and or administrative position. Do you want to
Administrative positions, we did receive 9 applications for administrator. We reviewed those. Many of those weren't qualified for the position. So what we're doing is effective tomorrow, we're going to get with administration to schedule interviews with the final 2 candidates for that admin position. And what we hope to do is have a decision and a contract in place before the next board meeting in February. So we're moving ahead on that.
Okay. Can everybody hear us okay? Hopefully. Okay. So environmental health update, I hope everybody got their reports. Dave, do you have anything to add to that or no?
The one thing that was on there was the Ohio EPA was doing the solid waste program update. That was finished up today. Passed. We'll get a letter in a few months saying that we are an approved health department to carry out the Ohio EPA solid waste programs. That's the attaboy we get from the state EPA for that. So it went well.
Good. Glad to hear that. Okay, and then we got the population health update. I thought it was very interesting and informative. Carol, would you like to speak a little bit about that? Or?
Does anyone have any questions about the report at all?
Well, I'm just wondering whether or not you would like to show the statistics, since we do have some people in the meeting who want to show any stats.
Statistics in particular.
Just the zip codes, the vaccinations, the target to reach. Just kind of an
Okay,
update on the school data, just because those are hot topics.
okay.
Thanks.
So zip codes and vaccination percentages, this is everyone that's, percentages of anyone that's received at least one dose of the vaccine. The ones that stand out the most are, I guess that need improvement, or however you want to look at it. 44062, only 24% of the individuals have received dose 1. That was a statistic that stood out. Another was 44046 at 41%. Vaccinations needed to reach the target, like 60% by age. It's broken down. The biggest demographic are the 5 to 9 year olds. We need like 1,864. Right now, we're at like 23% of them that has received at least one dose. We do a school conversion rate. So let me go over this first for positive students. This is going to change a little bit. We're getting some new guidance from MDH. It's not something that I could effectively explain right now because it's something that's rolling out. It's in the process of rolling out.
And they started rolling it out like today, like
So
hours ago.
what we do is we have the schools, when there is a positive case, they do the contact tracing. They reach out to the families, anyone that's been in close contact. They follow their protocol, however they're handling that. So we had a report from December 6th to January 16th of 389 positive students, 83 positive staff. They have documented 503 exposed students and 21 exposed staff. So if you break this down, what we do is we take all these line lists. When there's a positive case, the school puts together a line list of everyone that's been in contact. So we've been kind of tracking to see how many of those cases actually developed COVID, those that have come in close contact. And we put those totals together for a conversion rate. And as of right now, that I'm reporting today, when this report was put together, the conversion rate was 4.01% of the students or those and or teachers that came in contact that actually developed COVID. Now, the conversion rate is what they're changing up. The state is changing the way that they're going to calculate. They're not going to get into more of an individual based contact tracing or case investigation. They're transitioning over to where they're going to focus more on outbreaks. And they're going to focus that area instead of individually. So that's not something I'm prepared to talk about tonight. Like I said, they started rolling it out today and it's in the works. So I don't have all the details of that. Okay. There's only one thing that was really relevant that stood out to me. We had 0 hospitalizations from children, 118 at the time this report was calculated. It fluctuates by the hour, you can imagine. 118 adults, 118 hospitalization adults, 31 deaths. Average daily case rate of 98.2 cases. Total number of cases for December, 3,045 cases that were reported. With that said, we only had one case. We did have one child that was diagnosed with multi-system inflammatory, the inflammatory system. We had one child diagnosed with that in Geauga County. I think that stood out a little bit. Other than that, do you guys have any additional questions?
Very good, thank you. Okay, Lee?
Yeah. I see your outbreaks in the various facilities, so that's good. I mean, the information's good. Not the outbreaks.
Okay. So, do you want to, are you?
Yeah, so Alta's not here, so everyone got the administrative update. The real big news is that moving obviously to the new building. We are gonna get our first walkthrough of the building hopefully this week to at least see where we're going and how it's gonna look, things of that nature. They're still finding some quirks with the building, things need done, things need purchased, so we're gonna go over that with them, have a better idea of things that we need. The move is gonna be the biggest thing, so we're gonna figure out when we move, do we shut down for a day? Do we try to keep vital statistics up and running and have the staff work it that way? Because obviously vital stats is one of the ones I'm concerned about, given birth and death certificates need to be processed on a daily basis. And then obviously the vaccination clinic, we'll try to keep that up and running. The state nurses don't have so much to carry with them. But again, as we move, since it might be a different impact on how we move and what it impacts on our ability to react and how we do it. So we'll know more in the next couple of weeks as we find out where things are going, how long it's going to take, what the moving companies thinking, things of that nature. So that's the big 1,000-pound gorilla in the room with all of us, is moving all the staff over. I've done it with Lake County before. It's a couple times. It's a trip. Different staff take it different ways. Some get stressed out, some are okay, some don't like change, some do. Then you add in, maybe somebody not happy with something, trying to react to things. You'll have public who comes here instead of the new building, makes them frustrated with that. So, have a little bit of grace with the staff, with the directors. It's going to be some interesting times. We've been here, I'm trying to when these were built
Or bought.
I should say, yeah.
Yeah, 95, 96.
Yeah, it's
So
been a long time we've been here.
Yeah.
So it's going to be different. It's very different. It's going to be good, but different. So that's kind of the administrative update. The finance report is obviously in there as well. There's a slight appropriations change. That's for some unemployment costs that'll be incurred. And that's all that's for is that amount. And that's it.
Is there a reason why that went up so much?
Yeah, somebody claimed unemployment. And
Okay. Thank you.
we did not, I usually budget a placeholder so that if we have to react, we can. But I don't budget full. It depends on the person, depends on if the unemployment's been extended, things of that nature. So I do just enough to get us through, and then we go from there.
I just had one question on the accounts payable.
Yes.
There was an expense to a Mike Lowry plumbing for $465. I was just curious.
Refund.
Probably a refund.
364.
I think it's a refund.
Plumbing?
If it's plumbing though,
It would be a plumbing permit.
that's what I'm thinking.
Plumbing permit?
Yeah.
Depending on how many fixtures there were, probably is how I got that. Yeah. It's probably a plumbing permit, but it depends on fixtures. So we have to figure out if there are fixtures, and if it is a plumbing permit, we're assuming it is.
Well, more than likely with that number, that sounds more like a plumbing permit.
Yeah.
Okay.
Thanks.
Not too much is up that high besides plumbing.
Yeah.
And even plumbing's good price.
Any other questions about the finances? So do we have a move to approve the finance reports for January 2022 as presented?
So
Do we have a second?
A second.
Okay. Yes.
On this one, no.
Okay, so all in favor?
Aye.
Okay, any opposed? Okay. So then, how about if we move on to new business? Resolution 22-1, then and now purchase order. Do you want to explain that, or?
If I remember correctly, it was just the difference in something that was unprepared for this year. Carolyn caught it, and we're assuming that now, which they do occur. We try to avoid them, but they do occur.
Did this happen last month?
I think that was a different one that year end, and you can't open POs at the end of the year, and so it's one of those.
No, this one is the, for state campgrounds, there's a remittance fee that we have to pay for each campground license. It's $110. This specific one, they paid their license late. And then most of the time, most campground licenses are going in Marchish. They finally paid theirs in September. So it got lost in that time of year in 2018 to send that one, get that state remittance printed off by the clerical to get it then get to Carolyn to pay it. So we're having that program audited on Monday from ODH. So when we were getting prepared for it, we found the error and they were just like, okay, can you get us the money? And so this is what we got to do. So it's from 2018.
Yeah, I think we had one last month too, just it was different. It was not, that's my main point, they're not similar.
But we're not in trouble.
No,
I think it's just money moving,
Yeah.
bills coming in at different times.
Yeah, usually you have to, for those who don't know, usually you have to open a PO ahead of time before you spend the money. on occasion you have things like this, or you might have a purchase that we didn't plan for. And if you don't plan for it, you do it then now. Your guys' county likes the board to approve them, and in other counties, it might just go right through the process.
So Dave, you want to read the motion?
Yeah, I'd like to move 1.26.22-A to adopt resolution 2022-1 to authorize the payment of and now purchase order to Treasurer State of Ohio for a 2018 state camp license.
So do we have a second?
Second.
Okay, all in favor?
Aye.
Aye. Okay, that one passes. Next one, supplemental appropriation.
Yeah, so this one will be the unemployment. It's just a unexpected unemployment charge that came up. So we build enough, I usually build enough in there that if we have to get by, we get by until the next board meeting. This obviously being the next board meeting, so we're just asking for an increase to pay the unemployment that the county has charged us with.
Okay.
I had a question on this one.
Yeah.
On the resolution itself, it's got here from Ron Lady, okay, and supplemental appropriation request, increased Board of Health unemployment, 6002-053. Why is the Board of Health in there?
So that employee was charged out of Board of Health. They were also charged out of other funds.
that account.
Like
Okay.
that, yeah,
Okay.
so.
I wanted to see if we were gonna get unemployment, you know what
I mean,
Yeah.
that's up to you.
I mean? Yeah, yeah, have to get paid first. Right?
Yeah,
Yeah.
so general fund here in Geauga County, we call it Board of Health Fund instead of general fund. And so when you look at that, you have the resolution in front of you. When you look at increased Board of Health, comma, unemployment, comma, 6002, 6002 is called Board of Health, the fund.
I thought maybe we just got put in there.
No,
Okay,
not yet unless you want that.
Okay.
Good
All
question.
right, good. All right, I'd like to move 1.26.22-B to increase the 6002 Board of Health Unemployment Fund by $25,000 and the 6021-PAP, comma, other fund by $5,000.
So we have a motion. Do we have a second?
I'll second it.
Okay. We have a second. So all in favor?
Aye.
Aye. That one passed. Okay, next thing is resolution 22-2 OEPA, Water Pollution Control Loan Fund Agreement.
Yeah, Dave, you want to talk about WP
We've been awarded $150,000 for this grant cycle year, and it's for the 2021 grant cycle for the 2022 year. If I
Right.
remember it.
It's not the same, it's not a calendar year.
Yeah,
Okay.
It cycles differently. So I think that one's June or July, or September.
yeah, I think it's a July through
Yeah, July through
thing,
June.
because That's
Yeah.
the state budget goes that way. So we've been awarded $150,000. We need to adopt this resolution to have, in this case, we're asking you to have adopted so Adam can sign the paperwork when we do have people. And we've got 5 people in the queue right now to do systems. So when they are going through that process, we need to have paperwork signed and submitted to OEPA for funding and approvals. Adam would be that person to sign that stuff. And before it's, it was health commissioner at the time, whether it was Tom or Bob, they were the ones signing it, or myself when I was the interim, to get the monies to go back and forth and the approvals go back and forth. So we need a designated person. We're asking that Adam to be that designated person.
And maybe if you want to expedite this, so people need the
Yes.
money, we get that money instead of waiting.
So this is the same amount as last year?
Yeah,
This is the same amount that we've had
Last couple.
for at least 4, if not 5
it
years.
used to be 200, it was 300 before that.
It was 300 the first year, maybe the second year also, and then it dropped to like 2, and then at least the last 5, it's been at least 100. It's been the last 5 to 100.
And it's huge for this county, given that the state thinks we either have the most septics in a single county or the second most. So for us, this is huge. This is how we're gonna help people make sure they can keep their systems up and running with possibly some financial offset.
And how much can each family or home or septic get?
It's based on income, so they have to turn in,
Size do.
it's on the poverty, based on poverty scale, and they are awarded either at a 50% match, where they have to come up with 50% of the cost of the system, 85% coverage, where they have to come up with 15%, or at 100% coverage, where they don't, the only things they would have to come up for are the operation permit. That's not part, everybody has to pay for the operation permit on the septic side of it.
It's not an awful lot of people that can benefit from this though.
It's not much money, but it's something.
Correct. Like I said, we have 5 properties in the queue right now. We're waiting to get going on and we'll start getting through it.
It's a help and some of the citizens need it, so we're happy to offer it when we can.
So isn't there, aren't we trying to look into seeing if we could get additional?
Right.
I think, as far as in other grants that they're able, every county gets a set amount, and I think it's been 150 for everybody now for 4 years.
No one has gotten any more than $150,000 for the last 5 years. They've kind of just set it there and gone with it.
If we could apply for more, we would.
Yeah.
And we could probably use 300,000+ right now, but.
How many applications a year do you think we get for this, that people ask for?
So qualifying, we had 2 qualified last year. One pulled out at the last minute and said they were gonna do it themselves for whatever reason. And then the other one, the contractor pulled out. So they're the one where the contractor pulled out, they're right back in for this recycle.
So do we get the 150,000 whether people use it or not?
No.
So we
lost.
We lost.
It goes back into the pot and gets,
reasonable.
that's it, yeah.
Probably redistributed.
I guess there's probably a lot of people that may not know about this kind of
I would assume so.
assistance.
If 2 people applied
Well,
to have 50 to 100% of their.
the issue is it's time to get them through the process of getting us the financial information. They piecemeal it to us at times, as they give us one piece here and one piece there, and we're kind of just like waiting. And once they do get qualified, it goes out to bid to the contractors, and we set a deadline, and if sometimes no one bids, so then we got to reset it back out again.
Do we advertise this?
Well, yeah. So when we get someone in, we put everything together and we send out a letter, and with email now, it goes out to all the installers that are registered.
I mean, to homeowners, so do we advertise this, like if somebody comes in and says, I really need a septic system, I know they're expensive, can you help me with some options? Or even if they don't, is this readily available information if we?
So going back to the financial side of it, is there's lots of people that might be in need, but they are above the property level. That's the issue.
But are they aware of it? Meaning is it
Yeah.
on our,
Yeah,
is it on
so-
the website?
It's not always on the website. We're working on updating the website, obviously, as we mentioned.
Maybe it would be great to-
With our new staff that we have up with the clerical team, we have more staff to make sure that this is part of the packet where they understand these
I think
things.
that's a great idea.
Dave's ZH team,
It's money thrown away.
right, the sanitarian team knows to explain to people as if they see it as a need. And obviously, if they go to a $5 million house, the likelihood is probably it's not going to
Right,
happen.
they're not gonna hand them a flyer.
But obviously,
I think
the goal of the team is to make sure that everyone's aware of it, and they go, yeah, I qualify, or no, I don't, or can you help me determine if I qualify?
Right.
And
it would be great
think
to have
there's
like a flyer or
probably,
something.
I think there's probably a need to really let seniors know about this. That have stayed in their homes because they can't move.
So there's another option for them, is through the U.S. Department of Agriculture. They have a program that is more beneficial to them because it's not income-based.
Okay.
That's one of the big issues is the income.
How many applications do you get for that a year?
In general, less than 10.
So that means they don't know about it.
It's not
I
only
mean, that's my guess. If there's 2 people applying for this $150,000 and
Well, I
for the
think,
seniors, that means they don't know, but I mean,
yeah, and that's where I think working with, Jerry's not here right now, but working with Jerry Morgan and working
Yeah.
with the county to push this stuff out. And obviously, Dave's got a little more team support now with
Yeah.
having the 2 clerks back up and running.
Even to
yeah.
have a flyer, like if
Right.
somebody comes up to pay a permit or something and, we have it advertised appropriately to say income-based.
So again, going back, the issue for the seniors is it's again income-based, and USDA is the one that is more helpful to the
Okay,
seniors.
well, I
Good
think, but I think there could still be information put out to help direct people to.
Yeah, we can do it on the website.
Yeah.
I always think of the WIC program as an example.
Yeah.
The WIC program, usually you go on the website, whether it's your local WIC or the federal WIC, and it says, you know, do you qualify? And it says, what do you make? How do you determine what you make? How did you get to where you make? And then, you know, how many family members? So, yeah, so as Dave and I are working on that, we can, especially with Magali now doing the website and stuff, we can update that to have some better guidelines.
Flyers, I think, too.
Yeah.
And a lot of seniors don't go on, they don't, not being discriminatory, but
Yeah.
a lot of them, like my patients, they just don't use the computer.
Yeah, we can work on flyers. I know Jerry was a big guy with the flyers with different wastewater and stuff like that.
Yeah.
So the USDA one, we don't do anything with. All we do, I mean, literally, they have to handle, you know, the homeowner goes.
I think you're just asking about
But-
notification, like,
Yes,
do we
just
need
to
to make
know
them
what
just
available
know?
options there
Yeah.
are. It doesn't necessarily have to be through us, but, you know,
Right.
I think just having the information easily accessible to people.
Yeah, we'll definitely work on that so
Great.
people are aware where it's at. We just need a motion if you guys are.
Yeah, I'd
okay
like
with
to
that.
move 1.26.22-C to adopt resolution 2022-2, authorizing Adam Lithke, interim administrator, to apply for, accept, and enter into WPCLF agreement with the Ohio EPA.
So we have a motion, do we have a second?
Second.
Okay, all in favor?
Aye.
Okay, any opposed? Okay, that one passed.
I wanted to make one comment, just for Carol's knowledge, and I think this is good to improve vaccination rates. I know our office, it took months, but we finally got approved and got our shipment of vaccines. Like, normally you could just you had to go to a pharmacy, Department of Health, but I think now that the provider offices are getting vaccine, we have to have a training on Friday. So starting Monday, we'll be able to give vaccine and boosters. And I think that's huge, you know, so I think that'll improve some of the vaccination rates. I don't know how many offices so far have them, I just know since the beginning of the vaccines, we've been calling and trying to apply, and finally, at least through UH.
I mean, it'll be huge for us just because we don't know how much longer we have the state nurses. And when those state nurses go away, we don't have the
Right.
personnel.
And this is huge, because you catch them while they're there, oh, well, I'm here for this or that, or, you know, and we catch flu, we catch pneumovax, and so it's just something that'll help those numbers.
Yeah, Carol's team's been awesome with that. The state nurses have been really great about it, and it's, I've heard so many just great statements coming from them as they leave, you know, including county officials who've come through and said, you know, I didn't tell them who I was. Most people didn't know who I was, but it was a seamless thing for a government entity. You know, that's usually their qualifying statements for a government entity. It was amazing. So that's Carol and her staff though. They've been awesome. Yeah. So the next one, March and December 2022 Board of Health meeting. We set our schedule. Then after that, the HDAC set their meeting, and the meeting is on the fourth Wednesday. So we cannot, or I would not advise we have our Board of Health meeting just prior to the HDAC meeting, because we'll probably be here at that point for a 16-hour day in meetings, half of it. So the alternative, which Alt and I looked at, that the calendar is available for, is instead of the fourth Wednesday in March, we do March 21st, which is the third Monday, as the March meeting. So we do the third Monday. Then the fourth Wednesday is going to be the HDAC meeting. Also send out updates if you guys are okay with that. The other one that came up, which just ironically, we tried to correct an issue and then it caused a different one. The fourth in December, the third Wednesday is actually the 21st, which ran into some issues with obviously the holidays right there. If we did the third Monday for that one as well, it alleviates most of the issues and allows the staff to still be able to take vacation time. Because you remember that was my main concern with doing it right around that time, was not only for all of you, because then you have to be here in the middle of a Christmas week or holiday week, the same thing for the staff. So I if possible, I'd like to do it on Monday. That way, these lovely people here, if they want to take off some of that week, they can be off and they don't have to worry about coming in on a Wednesday to do a board meeting for a couple hours and leaving going back home. I think it's just
the second week of December?
Well, the second week's not enough time to get the finances and stuff lined up.
Okay.
We can't, there's just not enough time to balance and get everything out.
So 12 what?
12/19, which would be the third Monday. And that way we're done on a Monday. So if you guys want to travel or they want to travel, you get the whole rest of the week.
And then the third Monday, which is the 21st of March.
Yeah.
Anybody okay with that? Everybody okay?
Yeah.
Well, you're gonna be away?
Not me.
You're gonna be away too. The two doctors will not be available.
I
Okay.
have no idea if I'll be away.
I don't
Do you have
know.
another
Next
date,
week,
Patty?
What's that?
Another suggested date?
Any week but that week, it's up to you guys.
That week, I made a commitment to this one.
If the board's okay with it, the other reason for that is if we do it the fourth Monday, that's then right after Christmas, which causes a whole nother issue of people being off. I'm just trying to break it up where people do want to be off, they can be off. That's sort of messy.
Can we,
Oh, sorry, March.
can we table this?
We're talking
Or you
about
have
March.
to-
You can table it till next meeting, we have to do it, it's gotta be decided by then though, because obviously next one's March.
Oh, no, I'm talking December.
I thought we were talking December.
Yeah. They were saying they're off in March.
We're gonna be gone in March.
December's,
But
December
remember, we need,
19th is okay.
Yeah.
It's March, that's the
Yeah.
question.
we need, yeah, and, March, I can see that far ahead. And, I'm good on the 24th. I was not gonna be good on
The 21st is what it would be.
the 21st.
Yeah.
Yeah,
Any other week.
Any other week with that? In March,
Yeah, we could do it with them gone, but.
I mean, yeah,
I mean,
as long as you have a quorum, that's all that matters.
Yeah, we'll have a
quorum.
Yeah, as long as you have a quorum.
Okay, so let's go with March 21st.
Okay, so 21st and December 19th.
I
Those
may,
would be-
I may Zoom call you anyway.
You should, you can go right ahead.
could you have,
Will
Alta
you
get
pick
those
up?
out electronically?
Yes,
Out electronically, so they go to
Thank you.
calendar.
yeah, Alta will cancel the current ones and reissue the new ones, so that those are out for everybody. The other one, which is not on this, I did write up today, I would like to do a resolution and appreciation for Dr. Reed. We could have done it without her, honestly, and she was fantastic. You know, her and I would talk for hours every week during the pandemic. And she was always there, always answered for Carol, came in when we needed her. So I'll read the resolution. If everybody's in agreement with it, I'll take it out to her. But it's a resolution of appreciation for Dr. Jennifer Williams Reed for her dedicated service to the residents of Geauga County. Whereas Jennifer Williams Reed was appointed by the Board of Health as medical director on September 2nd, 2020, and interim health commissioner on September 3rd, 2021. And whereas Jennifer Williams Reed served the residents of Geauga County as interim health commissioner during the COVID-19 pandemic with great care to protect the lives and livelihoods of Geauga County residents. And whereas Jennifer Williams Reed was faithful to public health principles and supportive to the staff of Geauga Public Health. And whereas Jennifer Williams Reed was a strong advocate for the strong local community and put service to her community above all else. And whereas Jennifer Williams Reed helped guide the actions of the Board of Health and Geauga Public Health staff as interim health commissioner. And whereas Jennifer Williams Reed always displayed passion, loyalty, and the unique kindness towards Geauga County residents, Board of Health, and the Geauga Public Health staff. And whereas Jennifer Williams Reed was the ideal person to lead Geauga Public Health, she always contributed to the discussion when tough decisions had to be made. And whereas Jennifer Williams Reed will be honored by the Board of Health through this resolution and memories of leading Geauga Public Health through the COVID-19 pandemic, and now therefore be resolved that the members of the Board of Health, the health district staff, and the members of the members of the community wish to say thank you for your dedicated service to the board and your fellow Geauga County residents presented this 26th day of January 2022. For Dr. Reed. And whereas so that's how resolutions are written.
Yeah. Any questions? Anybody have any questions?
No.
I would just like to say that I think we all should be appreciative of Dr. Reed. She was put in a very, very tough position when we had to let our health commissioner go, and she definitely stepped up, and she was really great, and we should be fortunate that we had her in this position for the time that we did. So, and she got along great with our interim administrator. She worked fantastic with the nursing director, and so I just want to say that I really, really appreciated her. And I will also say that I had quite a few conversations about trying to convince her to remain on the board as a health commissioner, but I'm sure Dr. Cameron will fill her shoes. So that's all I wanted to say.
Need a resolution for that.
Yeah, a resolution. I would just, if we do a resolution to approve a resolution of appreciation for Dr. Williams Reed.
So moved.
Second.
Okay, all in favor? Aye. Any opposed? Okay, that one passes.
Very unanimous.
And then public comment session, we'll move to that.
Okay, so public comment section, before we get into that, I would like to say a couple words. And unfortunately, I wish there was more guests here this evening, but anyway, at the last board meeting, it was brought to my attention that that some of you felt that a few people that were here were kind of uncomfortable by, whether it be by being cornered from somebody who didn't agree with their view or whatever, and I was very disappointed to hear that. I just would like to remind everybody that we all have a right to attend meetings, okay? We should be respectful, whether you agree with the person or you don't agree is irrelevant. We expect everybody to be respectful to each other. Whether you choose to wear a mask or not wear a mask, that has no bearing. You know, we want everybody to feel welcomed and not feel like they're being whatever, picked on or whatever, okay? And like I said, I was very disappointed when I heard that. The other thing is the GPH meetings are run and controlled by the 5 board members here on this board and the administrator. Basically, we determine when the meeting is, where the meeting is, and how the meeting is conducted. We set the ground rules and everyone is invited to attend. I encourage everybody to attend the meeting, including other agencies, including elected officials, including, citizens of Geauga County. We're happy that you come to our meetings. But with that being said, we do not want to give the impression that we're siding with one side or the other. Okay, we want to make sure everybody is treated equally and fairly. And the best way to do this is, we try to give everybody an opportunity to speak, and, whether you're whatever side you're on, if you're, pro-vaccine or not, we want to hear what the people have to say. So, and then the last thing is the policy of the Geauga Public Health is to respect the residents and businesses of this county. We make recommendations, okay? We set policy as to the latest information that is available to us. Policies can change over time as more current information becomes available. I think this is so evident since this pandemic started in two years ago. We really knew nothing about this, and we know so much more today than we did back then. So I just, and I know it's frustrating because everybody's, well, they're changing their mind, they're changing their rules, we're changing policies, but we're trying to do the best we can, and I think our staff has done a great job, and we're only so many people. We cannot, we can't, they say, well, why don't you investigate this, investigate that, or whatever. We can only do what we can do. So as an example, we offer vaccine clinics. We do not mandate people have to come in and get a vaccine, but we offer it as a convenience, and we want anybody that wants to be able to get it, we want it available here, okay? If you don't want to take the vaccine, that's perfectly your choice. And then what else? The last thing, like I said, the pandemic, I do not mean to minimize it at all, and please don't take this that way, okay? But we have a lot, us as a Board of Health, we have a lot of work to do, okay? We're not just doing, population health or worrying about just the pandemic. We have to balance other things like, environmental health, septic systems, wells, administrative issues, okay? So, that's why, a lot of times I know people get upset because we have to go into an executive session or whatever, but, we have different things. We have a lawsuit that we have to confer with our attorney. We require updates periodically, and that's why we do what we do. So with that being said, I hope everybody appreciates what I just said, and thank you very much.
I have a question. Is Amy Patterson from the Maple Leaf here?
She is not.
Okay.
And Rich, I would suggest that those same statements be made when we have a next big meeting too.
That's probably, I think that's a great idea, so. And hopefully they heard me on GTV or League of Women Voters.
And
Okay.
also, I just want to make a note, a message to the media, to people who are writing articles and all that. Please get your quotes correct. If you're going to quote something that is said by one of us in the meeting, get it correct. And if you need follow-up, you are certainly welcome to call and follow up. I've tried reaching out. But that's real important. If you're going to tell your story, then do not misquote me.
All right, anything else, board? Dave?
Nope.
Okay, so with that, I guess we can go into public comment session. Basically, the session will last about 20 minutes. I don't know if we'll make it that long, but you get 2 minutes per speaker to make comments and ask questions. The board generally does not answer questions right away. We like to have an opportunity to investigate our responses, make sure what we say is correct. So with that being said, it's not like a press conference where answers should be expected on the spot.
And we've been putting a lot of the questions, answers on the website under the FAQ page, just to clarify.
And that's a new improvement, hopefully, if you look on the on the website. We have FAQs on there.
Yes. Magali Rios, who's under Carol, has been doing a great job updating that with Dr. Reed. She'll continue with Dr. Cameron, trying to provide as many answers, concise answers as possible, with links via the website.
Okay, so who would like to speak? Somebody.
You're not going in order? I'll be first.
I didn't grab the sign sheet because there's not 100 people. When you're ready, go ahead.
My name is Vicki Liss, and thank you for your comment, Dr. Hood. That is my subject tonight. I need to give you some information to set up the questions, and if my 2 minutes runs out, I will give you this piece of paper because Amy Patterson is the one who needs to be spoken to. On January 18th, DPS reported on Facebook the current COVID data from ODH, and it had a high of on 12.58 cases of COVID in the hospital in Geauga County. If they were all at UH Geauga, that's only 8.2% of the beds in the hospital. And I get that that's just one day, okay? However, looking at the chart from many days prior and after, there were only 2 patients who were admitted for COVID. In listening to the recording of the last meeting, Ms. Jones stated that there were COVID positive patients at Geauga Hospital from other hospitals, at least 4 other hospitals in the Cleveland area, and even Columbus and Cincinnati, making the numbers look like we are a mess in Geauga County, and we are not. And I would like for all, including the newspapers, to stop pretending that all these hospitalizations are from residents in Geauga County. Are those people from outside Geauga County being counted in our reports from Geauga County to the Ohio Department of Health? The Geauga County Maple Leaf has quoted an unidentified nurse and the New York Times COVID tracker saying Geauga County was the highest in any county in the country with COVID cases, and the Facebook post she called you out for not correcting her on anything. Now, I thought that was the responsibility of the reporter, not the responsibility of the board. Maybe you need to make a call.
I gotta cut you off. 2 minutes.
I'm sorry.
The audio is going through the mic. It's not picking up my phone, so
Okay.
I will grab that. Are you okay with me taking the paper?
Yeah, if you could give me a few more minutes, there's only like 5 people here.
That
Is that
I
okay?
can stay with 2 minutes. I can't make that decision. I'm just like.
Is that okay?
I think we're gonna have to stick with 2 minutes. Just had a pretty in-depth discussion about that previously, and I hate to go back on my word.
Okay.
Unless the board wants to overrule me, but
No.
we're good. Okay. I'm sorry.
That's not the only example, there's more here.
Do you want to take that? All right. That's why I know you said you wanted to go to the board, so I'll just make a copy real quick and I'll get back to you.
Yeah. Okay, so the next person, please.
I would like to comment, but did you have something?
No.
Okay, all right. I'll wait.
Ready?
Shelley Lewis with the League of Women Voters of Geauga. First, I want to say welcome to Dr. Cameron, and we wish you the best and best wishes for success. We want to thank GTV for being here and live streaming and recording this. We've done work with them in the past, and they do a good product. And our only hope is that in any coming meetings, they would be able to use the chat function so that the public could engage. I wanted to let you know that on our live stream to YouTube, we have 17 to 22 participants. Let's see. I wanted to let the board know that we have received positive feedback about your pre-vaccine clinics because we share them, our social media, and people have responded very well to this. The two items from the public, people are requesting that the executive sessions be held at the end. And then Meg Hawkins would like to know what the criteria and process will be for selecting the new board member. That's it. Thank you.
Yep, thank you. So do one of you guys want to decide, tell them how the HDAC thing works, or?
Yeah, what you can do, as far as the new board member, it'll be my position is up, and we go every 5 years. My position is up, I believe, this February, if not with this meeting. And HDAC, which is the Health District Advisory Council, that has representatives from each one of the townships. They meet, and their meeting is coming up in, I think if you go on their website now or in the Maple Leaf, has all the criteria on what you need to do. That's what Erwin Leppel, that is from HDAC, has cited the article that's in Maple Leaf, just put in, new Board of Health member. And what you do is you have an interview with a couple of the HDAC members first, and then you have a presentation at their next meeting. And then HDAC decides at that time and at that meeting who the new member is going to be, and they'll go from there. So please, access that Maple Leaf article and then take it from there.
I have leftover time, so could I follow up?
Yeah, I cleared it, but yeah, you had a couple.
Okay, I think the question was more about what is the selection criteria? Like, how does this HDC?
They're actually legally separate from us, so they have their own criteria.
Yeah.
So the question is better
Suited for HDAC.
Correct.
To the
Yeah.
HDAC, yes.
All right, thank you.
Yeah, and most people don't know. So as a point of clarification, so Geauga Public Health is legally separate from the county. So even though we used to be called Geauga County Health Department or Geauga County Public Health, we're legally separate from the county. Also, the HDAC, the Health District Advisory Council, is legally separate from us. So that's made up of your township's trustees, things of that nature. I think last time we had 4 applicants or 3. I think 4.
That's when we had 8 last year.
No. What's she?
We had 8 this past year.
Yeah.
Oh, we only pulled in that many then, sorry. That's what we pulled in. We pulled in, I think, 4 for interviews or 5. So they pull in the interviews, they come in here, they do the interview process, and then it's their criteria. But it's all the townships and trustees and things of that nature.
They basically vote. Those members of that organization vote.
Yes.
And
So it's one, to be more accurate, it's one Geauga County Commissioner that attends. It's the mayors from each of the villages. We have, I think, 2 or 3 villages. And then it's one trustee from each of the 16 townships. And they're the ones that vote and, approve or deny who they want to sit on the board.
Yeah.
We do not select.
No.
Anyone else? No.
If it's okay with the rest of the board, Vicki, I'm reading your excerpt here, and this is great. One thing I do want to clarify, though, is with respect to your first paragraph and saying the quantity of cases in the hospital. With that being said, UH does report their data, I believe, to Carol, but I cannot speak on behalf of the number of cases or really with regard to anything for UH, as they're a completely separate entity from the Board of Health, just to clarify. But also, I do want to make sure that statement where it says that the making the numbers look like we are a mess here in Geauga County is not something I said.
Oh, yes, I know.
Okay,
Yes,
yes,
that's-
so,
that's
no,
it.
I certainly can empathize, and I don't really know the answer to whether they are counted into our numbers or not, if they are from outside hospitals too.
Generally, when they're reported a COVID case, it gets reported against into their county.
Into their county
Now,
residents.
If they die in Geauga County,
Mhm.
then that's a little bit different. It gets reported as a death in Geauga County.
Okay, which could absolutely be something that impacts if, whether Cleveland Medical Center, Cleveland Clinic, or Metro get patients transferred from Geneva or from other places around Ohio, can certainly impact numbers. So it's definitely hard to say if there's an accurate reflection, but that goes not just with COVID, but if you have a terrible car accident at a hospital and they get transferred to a level 1 trauma center, that counts as a death at that hospital for that cause as well. So it should essentially be that way across the board. So that's not necessarily surprising to say that the death would be counted at the place that the patient expired. But I just want to make sure it's clarified that, we are absolutely at one point, we were a mess in the hospital. I think that only people who work in the hospital could be the ones to say that, and people who work in healthcare can be the ones to say that if they're actually witnessing it. But it's hard for us to speak about that since we're not actually allowed to. We can speak about our experiences and how it is day to day, but I think that the best way to get the information in terms of the numbers is through our nursing report and through public relations through UH if there's any.
And that's essentially what I was saying, but that's not what the paper is.
No, I
doing.
certainly agree with you. I don't think that that was an accurate reflection.
No.
As the board definitely remains very neutral in our views and makes sure that we are very unbiased in what we are saying and try to make sure that we are empathetic to all community members within our county. And I want to make sure that you're right, there is an accurate portrayal of that. And so I do agree with Dr. Laban to make sure that, quotes are accurate because we are extremely passionate about these issues and care about the other members of this county, and we want that to be reflected.
Well, and we all have a standard we have to live up to in medicine and whatever job we do, and I want to know what standard she's being held to. I did reach out to her, I did not receive a call back. But the media has to take accountability. It's like having a platform, being able to say whatever you want while the rest of us are working in other fields and unable. I probably, when I get a little break from all this, I'll write a letter to the editor. That's one way to get that information out there. But clearly the media needs to be more accountable for their actions.
Right, and I mean, like I said in the letter, I worked as a nurse. During the AIDS epidemic. I didn't know what the heck was going on in the AIDS floor, and I couldn't speak to that to a reporter, not in any way, shape, or form, and that should have come from the media department of the hospital.
Can I say something? And that's where our data comes from. Our epidemiologist gets all the information through the source at the hospital that has been appointed to give her that information. This information changes, it can change hourly, right? People transferring out, people being discharged, unfortunately, if someone dies. So this is constantly shifting. We have to put this information together. We put it together several days in advance to give to the board.
Right.
By the time it gets to this meeting, this data could be incorrect.
Oh,
because
I'm not
it's
saying
done in
your
real
data.
time.
I'm just
So-
saying some nurse, UH, who she said was verified,
Right. Well,
that's not who she should be talking to.
obviously her credibility, I don't give much credibility. If you don't give your name, I don't give any credibility. I mean, I have people tell me stuff all the time, but if they don't want to, say who they are, I can't.
Right, and I get it's not your
consider it.
responsibility to correct a reporter, it should be her own self.
Well, if she's quoting us, I think it's my
Yes, I agree
responsibility
that.
as a
I agree.
physician for her to say what she said. And it ruins my credibility,
Mhm.
and it's just not accurate.
Right.
And they need to be held accountable because they've kind of been able recently to just do what they want.
And it's not an accurate reflection of our perception of, I can appreciate if that nurse was approached and had a picture painted of us or what was going on in these meetings and our views and was reached out to, and, I can empathize with the frustration, absolutely. And so, what that nurse reported, no, it's not wrong, but, there should absolutely be verification of that. But I certainly do think that what that nurse expressed is truthful. I don't think the article itself was truthful in the portrayal that it painted of the board and, the credibility that we've all worked so hard to establish.
So, why don't we continue? I'm sorry, Shelley, what's the lady next to you? Do you want to speak? No, in the front row. Did you want something?
I don't think she could get out from under all this.
No, I didn't want to say.
Okay. In the back?
No.
The Admiral, okay. Aren't you an Admiral or
Commander,
something?
sir, Commander.
Okay,
Sorry,
sorry.
Admiral, never going to. What is the COVID-19 tests and masks going to be available for the people in Geauga County?
Tests are available now. You go online. Masks, I don't think we have a plan to disseminate the masks.
We haven't received information if we're going to get them. Right now, they're rolling them out to certain grocery stores, certain pharmacies. I believe the information, and this is premature, I'm speaking prematurely. My understanding is that each individual would be eligible to have 3. I don't know exactly when they're gonna start the shipping process. As far as COVID tests here within the county, we have a small allocation that we did receive in the end of December, beginning of January. Beginning of January. We did not get our complete allocation. ODH had kind of changed a few things up. They were making the county health departments the point of distribution for the entire counties. First, we were gonna get the libraries test, then the libraries got their own test, which they went on ahead and distributed. I talked with my library contact today. She said the over 3,000 test kits that they got at the beginning of January, they were distributed in a day and a half. So my understanding is that Ohio Department of Health obviously has a very limited supply. They don't know when they're going to get additional tests. They're sending out a survey. In our call today, they're sending out a survey to the local health departments to see if they want to continue to participate in receiving the kits. Right now, all the kits that they have are being diverted to the schools to be able to keep the kids and the students in school. And with the federal rollout, with the COVID tests through the Biden administration, that's also the Binex now, COVID tests. Those, I believe, I'm sure under contract with Binex, they're gonna meet that fulfillment before, and we'll get probably, what's left or what's available after that. So we do plan as a county to continue to participate in it. We do have enough allocation right now set aside just for the infrastructure to be able to keep it up and running, especially during these winter months, police, fire, road crews. But other than that, we're just waiting for our next allocation to come in, and we do not have any guidelines as to when that's going to be.
Yeah, one thing that we did as a county, not just as like a health department, but as a county, Carol, myself, and Sarah Sullivan, as well as a couple others, we took and pulled, with the help of the EMA, the entire county together, almost the entire county, I should say, and got what we would need if we needed to test X number of people per department. With my big concern along with Carol's was the jail, the roads, police, fire, water plants, things that if they go down, the county could technically go down. We put test kits in reserves for that. We issued out tests as available to other entities to make sure they have some available, to make sure that our county is up and running. And to Carol's credit, as well as her team, we've been ordering tests every time we're allowed. And when this new testing changed, it was based on what your last allocations were. So had we have not been doing this and just ordering, 10 at a time as a random number, our allocation might have been 10. But instead we've been ordering thousands, and so our allocation was thousands. And although it's a small number for a population of 93,000 people, it's a lot better than a lot of people got, I can tell you that right now. And so if people want them, we've been making them available. Obviously, make sure the county's up and running, and so that your core services that everyone here needs is available.
What about the nursing homes? Are they given opportunity to get the masks and the tests too?
They should. Masking, my understanding is yes. The test kits, they have a separate place they can order through, and I'm trying to think, there's Department of Aging maybe? I want to say it's Department of Aging. They have their own separate one. Carol and I have some plans for that if it happens. By no means is my goal that if, Department A out there was on our list and they're in desperate need, we're gonna make sure that the Department A is taking care of it the best that we can. We're not gonna leave someone out there just because they were left off the list on accident. Or if they're a high risk category, so someone up there in age, certain mobilities, we would make sure those people are taken care of as a precaution, the best that we can.
Thank you.
That said, and the public needs to know that you do not need to have 8 negative tests in 24 hours to know if you don't have COVID. You do not need to hoard 30 tests just in case. And that's from fear and panic, and I get that, but people are sitting with tons of tests. And I think with some instruction from healthcare providers, direction from us on the website, when to test, how frequent, and perhaps some of those tests will be available to nursing homes and the high risk rather than someone with 30 tests at home waiting for COVID to hit. We need to be responsible.
Agreed.
Thank you.
Thank you.
Is there a way to get those tests anonymously in case somebody doesn't want to call and leave their name and their address and whatever?
The best one for anonymously is the libraries.
Yeah, they're great.
For ours, we have an online form. Not saying it wouldn't help somebody. The online form is an accountability thing, not only for us, but when it comes to allocating the thousands that we have, that's the one way we can do it and not run out and not know we ran out. That's the one way we've been working. Carol's working with the libraries, because what used to stink is when someone would call in and say, "Hey, Carol, I need a test kit," and we'd say, "Well, we don't have any." Well, who can we go to? We go, "We don't know. We don't know who has it." Now we've come together, I think, significantly better, and hopefully, whatever the next situation is that arises in Geauga County, these bridges are being built so that the next time, whatever happens, fire, train derailment, we can react more consistently as a county. But yeah, I mean, the best way is through the libraries, though. We'll help if we'll help the best we can.
The other thing I wanted to say too is, with our interim administrator, I don't know how much the public knows, but I know for a fact that if somebody got a call that they didn't have something, this department will take some of the stuff, whether it be a vaccine or a test kit, and they will run it out to wherever it is needed. And that also applies for people outside this county. I've heard of other stories where we go, if somebody from another county calls, if we have enough, we will lend it out. So
Carol and I have driven to a couple schools if a school calls and says they have kids that need stuff,
he goes out there.
we will make sure we go out there, and the county comes first in all things. The county comes first.
If we're asking clarifying questions,
sure.
I would like to clarify something with Carol. And it has to do with the data that Vicki is referring to, because I've been watching that on Facebook as well. And there's a graph that's shared that it's just unclear to me what's being reported. It's the COVID cases. And I'm not sure, because it gives it day by day, I'm not sure if that's total COVID cases for that day versus new COVID cases for that day. And I've seen people interpreting it as, oh, there's only 2 COVID cases. And I'm thinking that that's actually, there were 2 new COVID cases that day. So that particular
The one
graph
you're referring to, if I remember correctly, is that day.
is that day. I
Yeah,
think that
so-
needs to be clarified because
so
it's being misinterpreted.
Yeah, so on Facebook, so I just pull up Facebook because that's the easiest way to do it.
Mhm.
When you pull up the post, and this is a Facebook issue, it doesn't say the description of each graph. When you click on the post, at least on iPhone, it brings it up and it says below is a graph of the number of hospitalizations for those with COVID-19 in Geauga County for the previous 3 months. As of January 15th, there were 2 new hospitalizations that day. But you have to click, I just clicked a picture, but you have to click the picture to get the graph's explanation. Now, if you just happen to, maybe on an iPad you can see this better. I can't see it on the phone.
No,
Then
you
you might
have to
not.
always click on the picture.
Okay.
Yeah.
I do understand what you're saying though.
I'm just pointing out that I'm
Yeah, same
seeing
way.
it misinterpreted a lot.
Yeah, so
So
when
I
look
don't know what else you can do to make it more
People are not
clear.
reading.
Yeah.
They
When I look
don't
on the
understand.
iPad, it's the same way that you have to click.
They don't understand. They don't understand what
Well,
they're reading.
All caps, something, you know, or when you see that people are misinterpreting it, can there be a correction? Because then it just gets shared, and then you have misinformation out in the community. So,
But there will always be misinformation if in fact people do not understand what they're reading. And how do we know?
well, because
How do we know
they
who's
state it, they state their
So we
understanding.
did, the one thing we did do, which I'm very excited for, I'm personally excited for, is we have a person who we've hired, internal promotions, I should say. She's now in charge of social media and the website. So before, I was Tom Quaid, the health commissioner, but obviously he was extremely busy. It wasn't like he had 80 hours a day just to sit on Facebook and read stuff. Now, we don't respond to everything because there's certain things that, per First Amendment, people can say whatever they want. But Magali has been responding to much more question and answers. A lot of it goes through myself and Carol. Obviously, I defer to Carol, or it was Jennifer Reed at the time, it would be Dr. Cameron. I defer to those two unless it's an administrative level question. But we have been trying to go through, and I'm not going to say contradict everything, but at least give a link, give an explanation, give a, hey, did you read this? And I look at that way simply because if I go buy I know you're not buying a product from us, but if I go buy a product and I ask on your Facebook page, what is the lifespan of the battery in this product? And you don't respond to me, I'm kind of like, so do you even care that I like your product, or do you not care? So we're trying to be more of, proactive, answer questions, address things if we can. And she's always said the website has also been significantly revamped with help of Dr. Reed, who will still be helping us in that capacity. But I think that's going to be a huge turning stone for us internally, is having someone that has the time. Because honestly, it's not like a ha-ha thing. Just Carol and I 12 hours a day, all we do is other stuff. So now we have someone who can help assist with that. Plus, if they see an issue where someone's consistently misinterpreting something, we actually had that already happen. We changed the wording on one of the graphs so that it says, please don't think it says this. And then they can read that. So that'd be one of those things that we could wrap into that. And Magali's been fantastic with that, being very proactive to help us. And
Shelley, I do see what you're saying though, because it sort of looks like daily total rather than daily new. So, and looking at that, it does say daily, but
until you click on it, though, it doesn't say the little word.
Correct, until you click on it, and then underneath it says what it is, but it doesn't say daily new. It just says daily. So I think we need to assume, going back to like a health literacy standpoint, break it down as simple as possible. I think the data is all absolutely correct there. I think it's open to interpretation though, and I think we need to make sure
There is no daily new. It's 2 weeks. It's the 2-week average, is it not?
It's a bed occupation.
So that with the hospitals, I don't know the lag time on that report.
Yeah, I'm not sure.
It depends on the hospital, I'm gonna guess.
Right, and so that's
The Ohio
point has been
Department of
clear.
Health COVID dashboard has really good stuff explaining how the graphs work.
Yeah.
And it's really very simple.
And you will see slight differences between the dashboard and ours, and that is because we get ours directly from the hospital, which has a delay. It also depends on how big the delay is. The same goes for the schools though, that conversion number. You've all heard me talk about it a million times. I'm very proud that we have that number, one of the few counties to do it, or at least we were. But there's a delay on that as well. So we factor delays and we factor people just not reporting
But it
things.
works basically the same way.
Yeah. I mean, in total, it should flush out. If we ended it today and we said a week from now, what is it? Theoretically, it should flush out and be the same, short of any adjustments that we're not made aware of.
So just to clarify, what I will say though is if there is a need for clarification on those graphs, if a comment is left and somebody says, can you please explain this or can you clarify, is that something Magali would respond to?
Generally, yes, she does look through them. I do read almost every comment on there. Not during the day, but usually maybe within a week. I do read every comment, and then Magali and I will talk, or Carol. I might send them one and say, hey, we need to address this. Okay. Like, this is blatantly wrong. Get Dr. Reed to send us a link to whatever information she has readily on hand, which is why we started the FAQ on the website.
Absolutely.
Was we can easily reference the website and say, there may be a misunderstanding. Please see the FAQ. Here's a link. And it's an easy way for us to correct some of the misinformation out there, or just help people. There's occasional time where someone goes, I need a COVID shot. How do I get it? And if we just didn't answer, they'd be like, well, you don't care. So instead, we tell them, Monday to Friday, come in between X to Y. It's free of charge. Just bring in your ID, or if you need a booster, your vaccine.
But we don't guarantee an immediate response.
Correct.
No, because
No.
and I think this needs to be stated, Magali has a full-time job.
Yeah.
She does this in addition to another job, so she doesn't sit there all day watching, comments coming through. And some of those comments, one person posts, this person, you're 80 comments down. There may be 20 questions in there and, how to decipher and go through and choose who, there just isn't enough time in the day to be able to do that. So things that are pertinent that we know that we can correct and that we can give accurate information on, we do.
Yep, it's a huge step forward for us. I think it's a huge step forward. So I think I'm excited. She does a good job.
There are some changes coming to that. We are trying to update some software for the webpage to be able to make it even a little bit more user-friendly and to add a few more features to it. So just kind of watch down the road for that too.
And I think
that's all in progress.
One thing I know, another on topic for the board to know is that the one thing that's tough for Carol and her team is that most of what we do is in paper. It's rare that we actually don't almost any computer systems besides health district information systems. So I know I frustrate some people when it comes to public records requests. I know Carol and I go back and forth because I do try to answer every public records request, even if I can't answer you. We don't have almost anything digital. Everything was paper. Now, that was a decision made way back when with how these immunizations went, that it was a paper system. I think hindsight, we go with the digital system, but hindsight's 2020. But that's the tough thing is we have thousands of files that are just hard files, and they're just somebody came in on Tuesday back in December. That's their file, Tuesday in December, and so it's not like we are a small health district-ish. We're 23 people, 24 people. But we don't have all this digital, so we couldn't, I can't go and pull things for you. And the states, I won't say it's odors is where it's at, what's the vaccine one? Impact Sys. You can't even filter out first shots in that system.
No,
So Carol can't even go into Impact and say, I want only first shots between now and the start of the vaccine. And then I can tell the board how many first shots we've done. We don't even have that ability in Impact. And that's a state-run system. That's not our system. It's antiquated, it's dated. But all those state ones, we don't have that ability. It's very difficult to run reports. So I know in today's day and age, when most of us can go on Amazon and run any history of report we've had in the past 10 years, any purchase, we can't even pull in the past year and a half how many shots we've given in terms of first shots, which is misleading because,
We manually count our inventory.
Right.
It's all done manually, manual reporting. We do not have a software for that.
And keep in mind, part of that is the levy we work on, which I know the board knows, but to give some credit, the levy we're on is almost 25 years old, and it's just been a renewal. It's not been an update. So we're still working on $550,000. Whereas when you look at other people in the state that have $3 and $4 million or $2 million, even our size, $1.5 million, we don't have, our funding is keeping the staffing going. And I think Dave was here back, we used to have like 35 people that worked here.
Yeah, when I first started, oh yeah.
It was 35-ish.
We had 10 nurses at one time,
Yeah.
before me, but there
And
were
that
10
was
nurses.
back in
alone.
like 04, 05.
So we don't, some of the stuff is just, I know people don't like to hear when I say, it's staffing levels. That's what it is. And honestly, Carol is generally the first person here. I mean, not to embarrass her, but she usually is. Her and I talk at weird hours. I'm sure her husband's gonna hit me one day in the truck. And then, we're on the weekends talking and emailing and stuff like that. That's just how things get done, is by hand and with a lot of hours. So I just want to give some clarification to that, because I know it's a frustration. I'd love to tell you guys some of that stuff. We don't have a way to get it.
Well, it goes back down to needing money.
Yep, it's always a problem.
And someday,
Every business.
people will understand the levy.
Yeah.
You only have so much money, you can only do so much.
Yeah. So
Okay.
it's now 8 o'clock, so I'm not going to kill everybody here by just boring you to death. But
Okay, so we
Next
all know
meeting.
when our next meeting is, February 23rd,
Yes.
2022.
That's
Hey, Jack, I need all
wonderful,
you
it's a
guys here.
live stream
Awesome.
meeting, so they can get
Meeting,
their
right?
stuff, yeah.
All right, meeting's adjourned. Thank you guys for coming.
Vote to adjourn. Vote to adjourn.
Vote to adjourn. Motion moved. Second.